Order. The Subcommittee on Supply will come to order. It's now 5:54 p.m. Subcommittee is meeting to consider the estimates for the Department of Addictions and Mental Health as outlined in Resolution E27. I'm going to read that resolution, Minister. Resolve that a sum not exceeding $268,631,000 be granted to the Lieutenant Governor to defray expenses in respect of the Office of Addictions and Mental Health pursuant to the estimate. I will now invite the Minister of Addictions and Mental Health to make opening remarks up to 1 hour. And if they wish, please introduce their staff during this time to the committee. I now recognize the Honourable Minister for Addictions and Mental Health.
Thank you, Mr. Chair. Can I just do a quick sound check?
Sound great.
Okay, thank you, Mr. Chair. Before I proceed, I'd just like to introduce the members of my senior team who are joining me here today. My Associate Deputy Minister, Kathleen Trott, and Christina King, who's Director of Finance and Treasury Board, who are supporting me in my capacity as responsible for the Office of Addictions and Mental Health, and also Francine Vesna, my Executive Director. I also have with me my Associate Deputy Minister of Communications, Nova Scotia, Donna McDonald, and Managing Director of Corporate Services, Angela Campbell, and Dave Denny is also here, Managing Director of Marketing. Mr. Chair, I'm pleased to be here to highlight the work of the Office of Addictions and Mental Health and to speak about priorities for the upcoming year. As you know, the health and wellness of Nova Scotians is a key focus of this government, including addictions and mental health. In fact, our government was the first to appoint a dedicated minister to oversee this work, a role I am honored to have given. The office is responsible for setting the strategic direction and funding for the delivery of addictions and mental health care in the province. We maintain a strong connection within the Department of Health and Wellness and the broader healthcare system. We also work alongside those in our education system, our justice system, and housing and community services network on solutions that make a positive impact on the health and well-being of Nova Scotians. The office works closely with the Nova Scotia Health, the IWK Mental Health and Addictions Programming. This program is part of a broader system of care in which a range of mental health and addiction services are delivered using a stepped care model. We also partner with numerous community-based organizations providing funding and supporting the delivery of important mental health and addiction services across the province. The office is responsible for ensuring harm reduction and anti-stigma approaches are taken in delivering mental health and addiction care in Nova Scotia. We are also responsible for ensuring Nova Scotians understand how to access the care that they need at the right time. That access to multiple services is streamlined, making the system easier to navigate. Those in need have access to services in the same manner, and that there's consistency and integration of practices across the 4 health zones. Mr. Chair, our office has been delivered a significant and critically important mandate that includes tackling stigma surrounding mental illness and addictions, eliminating barriers to accessing care, and expanding access to the right services and supports needed for recovery. I look forward to advancing this work and improving outcomes for Nova Scotians across the province. During my time as minister, as well as my time working on the front lines of addictions and mental health, I've had the opportunity to see firsthand the tremendous work and dedication of so many who work tirelessly to help those dealing with mental health and addictions. Their work encompasses the entire spectrum of support from clinical care to advancing efforts to address stigma and promoting the resilience and the overall well-being of Nova Scotians. These past 2 years have certainly increased the demands on our healthcare system, including addictions and mental health. I want to take a moment to acknowledge the unwavering dedication of so many on the front lines who have continued to be there to care for Nova Scotians in their time of need. Mr. Chair, in addition to having responsibility and oversight of the Office of Addictions and Mental Health, I also have the responsibility for Communications Nova Scotia. Mr. Chair, I would like to extend thanks to my deputies, associate deputies, and senior teams for their preparation of the office and agency's budget submissions and staff for the tremendous work throughout this very challenging year. I will speak more to the work of Communications Nova Scotia a little later on, but first I'd like to speak a bit to the office budget. Mr. Chair, budget for 2022-23 is just over $268 million, a budget increase of $20 million or 8.3% compared to last fiscal year. The office's budget is focused on advancing our commitments to Nova Scotians to improve access to mental health and addictions care, including investments in virtual care, withdrawal management, psychiatric services, and enhanced early intervention services for children with autism. I will get into further details on our budget and the work we have planned for the year ahead shortly. But first, I feel it's important to give an overview of mental health and addiction services in the province. The delivery of services involves a collaboration among government, health authorities, clinicians, and community-based organizations. Collectively, we deliver a provincial system of care promoting mental wellness and addressing individual mental health needs. This system is built on a 5-tiered model of care, which includes mental health promotion, self-management and community care, and formal, more intensive care for those experiencing moderate to severe complex disorders. Tier 1. Tier 1 supports are mainly focused on education and promotion of mental wellness. These might include efforts to increase awareness about the importance of looking after our mental health, or efforts to educate people on the harms associated with substance use. Tier 1 supports also include efforts to address the social determinants of mental health, such as improving access to employment and education, expanding green spaces, addressing discrimination, and providing stable finances, food security, and housing. There are a broad array of sectors, institutions, and programs that impact population mental health, including religious institutions, volunteer organizations, workplaces, schools, recreational facilities, and social media influencers, to just name a few. Cultural trends like an over-reliance on social media are increasingly implicated in the increased prevalence of depression and anxiety among our youth. Major events can also impact population mental health and well-being. We only have to consider the pandemic to appreciate how these events can impact us. They cause us to react with strong emotions like fear, sadness, loneliness, and frustration. Rather than seeking to eliminate our emotional responses to challenging life events, Tier 1 supports increases our resilience by allowing us to cope with our emotions. Tier 2. Mr. Chair, the largest need for mental health care in terms of population can be served through Tier 2 supports. These supports are typically provided by community-based organizations or in a primary care setting, such as supportive counseling provided by a family physician. They can also be delivered through self-managed or directed e-mental health modules or by those in helping professions who aren't necessarily providing direct clinical care, like a youth drop-in center staffed by peer support and non-clinical staff or volunteers. Organizations like Autism Nova Scotia, the Canadian Mental Health Association, and Reachability are just a few of the many groups that are delivering much needed support to Nova Scotians. Tiers 3, 4, and 5. Mr. Chair, the top 3 tiers of mental health and addiction care are focused on supporting those with moderate to severe illness. This population is what the formal mental health care system is focused on. These supports are provided through more intensive and specialized programs. It can include in-depth diagnostic assessments, medications, psychotherapy, intensive interdisciplinary care involving occupational therapy, recreation therapy, and social work case management. It's within these tiers that you will find inpatient care, intensive mental health and addiction day treatment programs, outpatient clinical services, and specialty care for illnesses like eating disorders. People with moderate to severe mental health needs can always benefit from lower intensity interventions like accessing nature. But people who require a lower level of support aren't likely to benefit from higher tier care. In fact, by labeling a person's distressing emotions and suffering in the face of real life stressors as a mental illness can do more harm than good. Make no mistake, people who are suffering need support. They just may not need formal mental health treatment. Frequently, society will regard someone suffering as a signifier of mental illness that requires clinical care. And when the system doesn't provide this for them, the conclusion they draw is that the system is broken. Mr. Chair, experiences over the past 2 years, including the events of April 18th and 19th, 2020, and the pandemic, have in many ways served to bring us closer together. We have shared the burden of suffering and worked to help each other. Just as Nova Scotians will continue to practice proper hand washing, staying home when we're not feeling well, and for many, masking in congregated spaces, I'm confident that we will also continue to support one another and to be mindful of our own mental health. Mr. Chair, we need to continuously look for opportunities to support individual and community resilience. This means working with other departments and sectors to find opportunities to positively impact the social determinants of mental health. It means supporting initiatives that promote individual resilience, as well as collaborative and collective sense of responsibility for our own mental health. And it means supporting organizations that provide localized community-based programming tailored to individual client needs regardless of a diagnosis. It is a priority of government to increase and improve access to mental health and addiction supports and treatments for Nova Scotians. One of the ways we can do this is by working more closely with community-based groups to build community resilience and foster mental wellness. Many of the province's community-based groups rely heavily on fundraising efforts to support the delivery of their programs. The inability to host in-person events and the reduction of discretionary income for many Nova Scotians as a result of a job loss or reduced hours has meant that these groups have struggled to make ends meet. It has created challenges for groups, but the work never stopped. In fact, demand for the critical supports and the programs they deliver has increased with the continued impact of the pandemic on the mental health of Nova Scotians. During these long and challenging 2 years, these groups never gave up on the people who needed them the most. We have heard from many of them. They've shared their financial hardships and demonstrated the need for greater support to get them through this hump. And this year, we were grateful to be in a position to offer that help. COVID also delayed the advancement of some initiatives this past year, leaving us with unspent funding that we were able to reallocate to support projects that we otherwise wouldn't have been able to, including $3 million to the Mental Health Foundation of Nova Scotia. The foundation will use this funding to administer grants for eligible organizations that provide mental health and addiction services. The foundation will share more information and details about how to apply for these grants in the coming months. I can tell you that the priority will be given to groups that serve Indigenous communities, members of the 2S LGBTQ+ communities, African Nova Scotians, newcomers, and persons with disabilities. We know that these populations often face barriers to accessing much needed support. By directing funding to support marginalized Nova Scotians, we can help to remove these barriers and ensure equitable access to mental health and addiction supports. We were also able to provide $2 million in funding Digicamic for the development of the first Mi'kmaq mental health and addiction strategy in the province's history. This strategy will guide the development of a comprehensive and culturally appropriate First Nations mental wellness system, a system that will offer needed mental health and addiction supports for the Mi'kmaq of Nova Scotia. We know the First Nations communities must have ownership over these supports, and they must be guided by their own cultural and traditional healing practices. The importance of placing services in community is grounded in a decades-long experience of intergenerational trauma. Mr. Chair, in addition to supporting the Mental Health Foundation and Digicamic, we have been able to direct funds to several other initiatives, including funding to the North End Community Health Center for the purchase of a new van, which will be used to support their managed alcohol withdrawal program. We've also provided funding to family resource centers to support their home visiting program for vulnerable and at-risk families, along with funding for Pathways Cape Breton to empower more people with mental illness, substance use, and social challenges to live more independently within their own communities. And we've given more support to HEART, a mental wellness program based out of the Heartwood Center for Community Youth Development in Halifax. I had the opportunity to meet with Kayla Bernard, the founder of HEART, who's one of Nova Scotia's few Mi'kmaq recreation therapists. She and her team are doing amazing work helping the youth and connecting them with their peers and expressing themselves through art. We were also able to reallocate funding to support the training of more peer outreach through the Posse Project, a project in Windsor, West Hants, Sipanaganny, and Sackville. Posse is an invaluable resource for youth who use substances and experience sexualized violence. Mr. Chair, I'd like to take a minute to speak to the importance of ensuring that our mental health and addiction services are representative and responsive to the diverse communities across the province. Over the past few months, I've had the chance to meet with the team at Eskazoni Access Open Minds Youth Site, as well as the chiefs of Eskazoni, Wagmattook, and Millbrook First Nations. and the health directors of community health centers in various Mi'kmaq communities across the province. I've also met with staff in the Mi'kmaq Native Friendship Center and with Digicamic to discuss mental health and addiction issues among Indigenous peoples and resourcing within our communities. My first official visit as minister was to Eskazoni, where I toured the community's health center, situated on the shores of the beautiful Brador Lakes. I also had the opportunity to tour a garden dedicated to missing and murdered Indigenous women and girls, a beautiful project that was created by the youth of the community. I would also like to note, as of yesterday, we would have made a first-time investment of $350,000 to cover the Eskazoni crisis line, which is utilized by First Nations communities across the province. In February, the Premier and I visited the Wagmatcook Wellness Court, the first and only court of its kind in an Indigenous community in Canada. I learned how the court is structured to meet the cultural and healing needs of those who come before it. What these and other visits have taught me is that we need to truly engage within communities. Mr. Chair, we will continue to work alongside African Nova Scotian Affairs and Ladino Affairs with members of the 2S LGBTQ+ community, with community organizations, and with individuals representing this province's diverse communities to address the added barriers these populations face and ensure their mental health and wellness recovery needs are met. This work will be supported by the hiring of a dedicated community liaison officer that will work within communities to support efforts to enhance community wellness and ensure we are all striving for the same goal. Mr. Chair, we recognize the impact that the Mass Casualty Commission's hearings will have on Nova Scotians. Information and discussion with the horrific events that took place in April 18th and 19th of 2020 will be difficult to avoid or ignore and will impact people in many different ways. But both the Mass Casualty Commission and the Department of Justice's victim services have supports in place to comfort survivors, immediate families, and impacted communities. The supports don't necessarily extend to all Nova Scotians. Government has a role to play in supporting Nova Scotians and ensuring they are aware and can easily access existing mental health support. We appreciate that the multitude of supports can be difficult to navigate, especially given the varied needs of those reaching out for help. We responded by partnering with 211 Nova Scotia to provide a focused point of access for available supports. 211 community navigators are available 24 hours a day, 7 days a week to connect Nova Scotians with appropriate services, including mental health supports. Mr. Chair, we will continue to support the delivery of community-based mental health and addiction programs. And we will seize opportunities to enhance the specialized formal mental health system to ensure better outcomes for those who suffer the most. The formal mental health system involves a collaboration among the government, the province's health authorities, including the Nova Scotia Health Authority, the IWK, and Digicamic. There are many ways Nova Scotians can access this system, including through physician referrals, the province's central intake line. Central intake is a single point of access to these supports. The line is staffed by clinicians, including registered nurses and psychologists who work with callers to assess their needs and provide referrals to the appropriate supports and treatment options. For example, help with anxiety could include distance-based intervention, connecting with an individual clinician for skills in managing anxiety, or a referral to an anxiety group. Through this stepped approach, our mental health and addiction system continues to ensure that quality interventions are provided. Government supports the central intake line with an annual $1 million investment. We recognize how important this resource is to Nova Scotians and know it has been especially so over the past 2 years. Intake team saw a 30% increase in demand for services in 21-22. Government recognized early on the COVID-19 and the measures undertaken to address its spread would impact the mental health of Nova Scotians. In fact, addictions and mental health has been a core component of Nova Scotia's public health response to COVID-19. We have and we continue to work closely with the health authorities and community not-for-profit partners to mitigate the negative mental health impacts for Nova Scotians. Mr. Chair, we worked with the Nova Scotia Health Authority and IWK to introduce an e-mental health tools and virtual care, including virtual group-based cognitive behavioral therapy. And we have engaged clinicians across the province who have added capacity to meet demand in other zones. Our work to further expand these supports will continue this year. E-mental health and addictions. Mr. Chair, we have increased funding this year for e-mental health and addictions care by more than 100%. This year's budget is just under $12 million. This will support collaboration with the Nova Scotia Health Authority, IWK, and other government departments to develop a coordinated, integrated, and efficient e-mental health system that best serves the needs of Nova Scotians. We have also invested an additional $3.4 million in this year's budget to expand mental health virtual care, including hiring 22 clinicians over 2 years for community mental health and addictions, outpatient clinics, and enhancing virtual care services at emergency departments. Mr. Chair, it is important to note is that people who are in crisis and require emergency care are seen right away. Our inpatient program ensures that everyone in need of a bed has access to one. No matter where they live in our province, no one is turned away. Mr. Chair, we need to continuously be looking for ways to improve the delivery of care and ensure we are meeting Nova Scotians where they are in their recovery journey. We know that there are many people who don't require around-the-clock inpatient care and can safely and successfully recover from addictions while remaining at home and within their communities. Earlier this year, we opened the province's first recovery support center in Dartmouth. A second center opened in the Aberdeen Hospital in February. These centers will improve direct access to support for people living with substance use and gambling disorders. They address that need while also linking people to increased or decreased levels of care based on their individual circumstances, including inpatient withdrawal management, opioid use disorder treatment, community mental health and addictions programs, and online supports. In total, 10 recovery support centers will be set up across the province over the next 2 years. This year's budget includes a 55% increase in funding for withdrawal management services for a total of $3 million. This investment will provide continued support for the Dartmouth site and support the implementation of 2 new sites, one in North Sydney and one in Truro. Just as the recovery support centers provide outpatient care to those struggling with substance use and gambling addictions, the province's new mental health day hospital provides a similar pathway to support for people requiring intensive mental health treatment. We know that successful health outcomes depend on the ability of Nova Scotians to access appropriate supports and treatments. Before the opening of this hospital, the only pathway to intensive mental health treatment was to be admitted to an inpatient psychiatric unit. But not everyone needs around-the-clock hospital care. The Mental Health Day Hospital addresses the gap and provides another way of delivering intensive mental health treatment while allowing patients to stay closely connected to their families and to their communities. Patients are supported by an interdisciplinary team of mental health specialists, including a newly hired psychiatrist, nursing staff, and social workers. They attend the therapeutic group programs and receive psychiatric treatments during the day and continue their recovery at home in the evenings and on the weekends. Mr. Chair, inpatient acute psychiatric units in Nova Scotia are functioning with very high occupancy rates. Occupancy rates in Central Zone regularly exceed 100%. This means that more patients have needed to be transferred to facilities in Western, Northern, and Eastern zones, putting patients farther away from their families and support networks and placing greater strains on these facilities. These interfacility transfers also reduce the number of ambulances available to respond to health emergencies and other patient transfers. These impacts are costly, inefficient, and most importantly, they aren't meeting the care needs of patients. This new hospital will help to alleviate these pressures and free up inpatient psychiatric beds for those with more severe mental illness. This year's budget includes just over $1 million to support continued operation of the day hospital. We will be reviewing and evaluating the model over the next year to identify potential opportunities for expansion to other areas of the province. Mr. Chair, the path to mental wellness is not a straight line with a clear start and finish. We must make sure that the right supports are available at the right time, at the right place to meet Nova Scotians where they are in their recovery. We know that early intervention treatment will reduce the need for inpatient support. Our plan for universal addictions mental health care coverage will make sure that people get the supports they need and that they get them sooner. We will ensure that all Nova Scotians, regardless of where they live or what their income is, have universal access to mental health and addiction services. This is a significant piece of work. It will take time and considerable consultation to ensure we get it right. I can assure you that work has been ongoing since this commitment and will continue to be a primary area of focus over the next year. We've allocated $500,000 in this year's budget to support our work in developing universal mental health and addiction care. Mr. Chair, we are breaking new ground as the first in the country to undertake this work. It is on us to collect the primary data. We don't have the luxury of leaning on lessons learned from other jurisdictions. We need to build this from the ground up. Evidence-based decisions and planning are critical to ensuring that we get it right. And that requires a comprehensive understanding of the population and community needs. We will also be engaging with mental health care professionals, sector partners, patients, families, and others throughout all phases of this monumental initiative as we work to build the country's first truly universal healthcare model for addictions and mental health. Mr. Chair, the Office of Addictions and Mental Health has worked alongside key government and health system partners, including Nova Scotia Health, to outline a new community network model for sexual violence trauma therapy. This new model will ensure services are available throughout the province, improve accountability, and ultimately enhance support for victims and survivors. It will provide consistency of services across the province for all genders and ensure programs are responsive to the needs of African, Nova Scotian, and Indigenous populations. It will also ensure administrative, program, and human resource coordination for trauma-specific therapeutic services across the province and across the gender spectrum. This work was informed with input from professionals, survivors, and community-based organizations that currently provide services to survivors of sexual violence. We also engaged African Nova Scotians, members of the Indigenous communities, immigrants, and newcomers to better understand programming needs for members of these populations. We issued a request for proposals in the fall to organizations, including those currently providing trauma-specific therapeutic counseling. The procurement process is still underway. We expect to be able to share some more details shortly. In the meantime, I want to assure Nova Scotians that there will be no disruptions in services as we transition to this new improved model of care. Mr. Chair, we of course recognize the importance of retention and recruitment in the delivery of existing and planned mental health and addictions care. There's no question that recruitment is a challenge here and across the country, a challenge that has been made worse by the pandemic. The new Office of Healthcare Professionals Recruitment has been created to put a dedicated, intense focus on recruiting and retaining the healthcare professionals needed in this province, including psychiatrists. We recently announced a new specialist physician incentive program. This program offers incentives to specialists who establish a practice outside of the central zone. Those who qualify can earn up to $125,000. This includes $25,000 when they sign the agreement and $20,000 per year for 5 years. This year's budget includes $275,000 to add 2 mental health and addictions clinical assistants in Eastern Zone, while psychiatrist recruitment is ongoing. We're also investing $140,000 to add 4 psychology residents, 2 each at the Nova Scotia Health Authority and the IWK. Several other initiatives have been implemented to improve psychiatric recruitment and retention, including the introduction of virtual care options, which allow psychiatrists more flexibility in being able to practice in areas of the province beyond where they live. Mr. Chair, another area of importance that the office is responsible for is preschool autism supports. We know how important it is that children with autism and their families have access to appropriate interventions and supports. We also recognize the value of early intervention for preschool age children on the autism spectrum and their families. The Office of Addictions and Mental Health collaborates with partners in the community, including Nova Scotia Health, IWK, Hearing and Speech Nova Scotia, Education and Early Childhood Development, and Autism Nova Scotia to enhance autism intervention services for children and their families. The current resources, programs, and supports available for preschool-age children with autism do not meet the growing demand. Families have had to wait too long to get the support they need. In some cases, parents have had to choose between waiting for support and having their child start school with their peers. This is not acceptable. Our budget includes $12 million to increase support for autism services. This investment will be directed to ensure supports are tailored around the needs of the child and their families. We expect diagnostic assessments will be done more quickly and navigating supports will be made easier. We expect to have further details to share on this investment in the coming weeks. Mr. Chair, I'd like to also speak about one of my other portfolios, Communications, Nova Scotia. Nova Scotians rely on government programs and services to support their health, education, and economic well-being. Every CNS employee understands that it's their job to help get important information to Nova Scotians about how to access these programs and services. Some CNS staff are very familiar faces in the House. But Mr. Speaker, CNS staff do other important work behind the scenes every day. This year and over the course of the pandemic, Nova Scotians have become more aware of that good work more than ever before. Nova Scotians counted on government for information they needed to stay healthy and safe. People tuned in record numbers to daily briefings, almost 200 of them, webcast live across the province. They visited our website also in record numbers, a website that sometimes changed hourly, knowing it was the most reliable source of up-to-date information on COVID-19 in our province. They followed us on Facebook, Twitter, Instagram, and TikTok, and shared our posts with their friends and followers. They saw posters and stickers and ads pretty much everywhere they went. Hospitals, grocery stores, hockey rinks, telling them to wear a mask and keep 6 feet apart. Partners and stakeholders across all sectors and in all communities received at times twice daily updates. CNS is also committed to accessible and inclusive communications. Every briefing included sign language and captioning. Graphic designers worked with African Nova Scotian partners to incorporate principles of Afrocentric design. And public health guidelines were translated into languages including Mi'kmaq, Arabic, Chinese, and Somali. Reporters who also had a very important job to do in keeping Nova Scotians informed. They received news releases and media advisories, sometimes 2 or more per day. Not to mention responses to thousands of questions not covered in media briefings or news releases or interviews. Before becoming minister, I appreciated everything CNS was doing to support Dr. Strain and to keep me and my family safe, even though I didn't know it was CNS staff who were behind this work. But I truly have a new appreciation now in a whole new way. As minister responsible, I'm working with the people who manage those social media accounts, who lead the research, who write and translate those news releases, who produce those briefings, who capture the images and design the work, and who manage each and every one of the 7,000 projects that go through CNS each year. This team rose to an incredible challenge, at times working 7 days a week, evenings, weekends, holidays, giving up vacation, sacrificing family and personal time in the interest of public service. This is the CNS team and the CNS way. These are the people behind the numbers and behind the scenes. Of course, this is a budget, so I will speak briefly to those numbers. As a government, we are committed to digital transformation so Nova Scotians can access more services more easily online. To put all web of the best digital minds together, the CNS web team has joined the digital services team at Service Nova Scotia to push excellence in service delivery to new heights. Members will also see in our budget forecast that additional staff were needed for the COVID response last year. As we all learn to live with COVID, the communications efforts should ease. We have made adjustments in our budget and staffing to align with this. Even with these adjustments, I want to assure members of this House and all Nova Scotians, CNS will be there every day to meet its mission, to help Nova Scotians understand what their government is doing and why. Mr. Chair, before I conclude my remarks, I would like to take this opportunity to thank my staff who's all here with me. It's greatly appreciated. The teams and addictions of Office of Addictions Mental Health, and Communications Nova Scotia for their commitment to the people of the province. They accomplish great things every day, and I truly thank them for it. I would also like to thank the many frontline staff at the Nova Scotia Health, IWK, and community organizations across the province. Their dedication never wavered during these past 2 years. They continue to show up each and every day to support Nova Scotians when they needed them the most. I look forward to the opportunity to respond to your questions. Thank you, Mr. Chair.
Thank you, Minister. According to the practice as developed in this legislature, the opposition caucuses takes turns asking questions for approximately 1 hour each. During a caucus's turn, the members within a caucus may take turns examining the minister on estimate resolution. Only the minister may answer questions. Caucuses are also expected to share time fairly with the independent member. To begin the examination, I now recognize the official opposition. I recognize the honourable member for Fairview Clayton Park, and the time is 6:30.
Thank you, Mr. Chair, and thanks to the Minister for those opening remarks. Mr. Chair, last year the Premier campaigned and won the provincial election in part due to his plan to create universal mental health care and his pledge for an additional $102 million to deliver on that promise. The budget's here, and quite frankly, I'm disappointed. The budget includes $268.6 million for mental health and addictions, which is an increase of $20.6 million, but is also $81.4 million short to deliver universal mental health. So my question through you, Mr. Chair, to the Minister, in your platform, the Premier said that he would make good on this promise as, quote, they are investments that we cannot afford not to make, end quote. Can the Minister please explain why the gap between what was promised and what appears in this budget?
I recognize the Honourable Minister for Addictions and Mental Health.
Thank you, Mr. Chair, and I thank the honourable member for the question. I know this has probably been the most frequently asked question to myself since being put in this first time ministerial portfolio, I think, for the province, which is understandable. I think, as I kind of mentioned in my opening remarks, we're the first jurisdiction in the country to undergo this bold initiative. So you need to have, proper data, proper evidence-based guidelines, lay the foundation, I think, to do it once and do it right. I think to realistically say that can be done in seven months for the first time in the history of the province is probably unrealistic, to be quite frank. There's a rapid process ongoing right now within the department, including a significant data analysis, engaging with robust stakeholders across the province, mental health care clinicians, ranging from psychologists to social workers to counseling therapists to peer support workers. I think that it is noteworthy that we did make some significant investments in a very short time. Particularly quite proud of the investment in Tejikamic, the first time in the history of the province. This initiative, first time it's ever been funded, basically. And so I think it's a very exciting initiative. So I think the universal access piece specifically, I think it's very much the underlying premise is that people that need the care they can get it regardless of their ability to pay, right? Very much like our primary healthcare system. So I know there's significant work underway right now, and I think I'll have much more to say about that in the near future. Thank you.
I recognize the Honourable Member for Fairview Clayton Park.
Thank you, Mr. Chair, and thank you to the Minister for that response. But the question is rooted in a promise, not in practicality. So there was a promise and a commitment that was made during an election campaign, and dollars and cents were attached to that promise. So there was nothing in the preface of my question that expects the Minister to have universal mental health care fixed in 7 months, but there was an actual dollar amount that was promised, and there is a shortfall in this budget. So my question is in the discrepancy between the dollar amount that was promised last year and the dollar amount that's been committed to in this budget.
I recognize the Honourable Minister for Addictions and Mental Health.
Thank you, Mr. Chair, and I thank the member for the question. So as I mentioned in my opening remarks, we do have $500,000 in the budget to begin this foundational work, especially from a research perspective. The universal mental health care component is a key part. I would say the most significant part of my mandate, being the first minister responsible for this. So I think I've kind of said this in the House at a number of different occasions, but I really feel a great deal of responsibility to do it once and to do it right. I think the foundation is actively being laid. And there needs to be a significant engagement, not just with clinicians, but with Nova Scotians, specifically people with lived experience and their families. So yeah, thank you, Mr. Chair.
I recognize the Honourable Member for Fairview Clayton Park.
Thank you, Mr. Chair. And again, just trying to get some clarity. So is the minister saying that the $102 million that was promised is not going to be delivered? Is it going to be more than that? Is it going to be less than that? Again, I'm not speaking to the practicality of how much time it's going to take and what who needs to be consulted, what stakeholders need to be engaged. I appreciate that the minister wants to do it properly, and I think that's a sincere desire. The question really is around the financial expectations. So the promise of 102 million, we know that the Canadian Mental Health Association has called on the government to invest at least 230 million into mental health and substance care to meet the World Health Organization's recommendation of spending at least 10% of the total Department of Health and Wellness's spending on mental health and addictions programs. So are we looking at, so again, this promise of 102 million, is that gone? Is that still in play? And why wouldn't it be attached to this budget, since it was such a strong part of the election campaign last year and is half of what is asked for by the Canadian Mental Health Association?
I recognize the Honourable Minister for Addictions and Mental Health.
Thank you, Mr. Chair, and I thank the member for the question. Yeah, so I think, the 8.3% increase, over $20 million is significant for sure, whether you're looking at, autism services or virtual mental health and very, very important programs that can help people very soon. I think, the universal mental health care piece is very exciting. It's very challenging. It's something I'm very focused on. I know I've had some very significant conversations with my federal counterpart, which I think has been very productive. But I think the universal mental health care is something I'm fully committed to. Like I said, the foundation is being laid right now, and there'll be much more to say in the near future. Thank you.
I recognize the Honourable Member for Fairview Clayton Park.
Thank you, Mr. Chair. Thank you to the minister. We'll step away from this for a little bit. But but you're not off the hook yet, Minister. We're gonna get you to give me a number. I don't. We're not gonna. You and I would not disagree, or the minister and I would not disagree, Mr. Chair, on the good intention, on the determination, on the capability of the minister in developing this and laying a foundation. Like, it's not, there's no argument there. The question that we talk about here is the cost. And again, maybe we won't, maybe I'm going to push it one more time. The $102 million that was promised by the Premier in the campaign last summer didn't come out of thin air. That must have been costed in some way. There must have been something that dollar amount came from somewhere. So now that the minister is in the office and the groundwork is being laid, we have a shortfall of $81.4 million from what's committed in this budget to that promise. To confuse the matter even further, we have a challenge from the Canadian Mental Health Association, which is calling on the government to invest at least $230 million into mental health and addictions, which would be the 10% number that the World Health Organization recommends. What numbers are we actually playing with here? What is going to be the cost of universal mental health care? Ballpark, given the research that has been done, given the work that has been done, this is a very serious and important platform promise. It's a commitment of the minister and it is part of his mandate. So what number are we looking at in terms of universal mental health care at this point?
I recognize the Honourable Minister for Addictions and Mental Health.
Thank you, Mr. Chair. I thank the member for the question. So I think it would be fair to say that we're just getting started in many ways with this bold initiative. Like I said before, the foundation is being laid. There's a very robust stakeholder engagement piece that's ongoing right now with healthcare clinicians, with citizens, with people with lived experience. And these things take time for sure. So whenever I feel confident that we have, significant data and evidence and robust research to give a firm number, I'd be happy to do so for the member. Thank you.
I recognize the Honourable Member for Fairview Clayton Park.
Thank you, Mr. Chair, and thanks to the minister. Let's talk about wait times. Our priority should be to ensure that those who need mental health and addiction services the most get their services as quickly as possible. People in crisis and require emergency care need to be seen right away. Over the last year, Mr. Chair, through you to the minister, how many clients were served through the NSHA and through the IWK mental health programs? And if possible, do you have a breakdown of the clients served by region?
I recognize the Honourable Minister for Addictions and Mental Health.
Thank you, Mr. Chair. I thank the member for the question. So basically, the way it works, it's actually broken down into specific programs. So inpatient services, for example, a community-based treatment those sorts of specifics. So it'd be difficult to give a totality number, but if you wanted a specific program, I could see if the staff here could maybe find that for you. Thank you.
I recognize the honourable member for Fairview Clayton Park.
Well, thank you, Mr. Chair. And yes, I'd like to know the numbers of who, of all of the programs that are pertaining to mental health and addiction. So if we could get those numbers and a breakdown of the clients served by region. I understand if the minister or staff don't necessarily have that tonight, but yes, if we could get that for the sake of the House, that would be appreciated.
I recognize the honourable minister for Addictions and Mental Health.
Thank you, Mr. Chair. Yeah, maybe to the member, I'll make a note with my staff here now, and I'll get them to follow up with specifics if that's okay. Thank you.
I recognize the honourable member for Fairview Clayton Park.
Thank you, Mr. Chair. Yeah, that's that the delivery of those numbers is great. It's okay if he doesn't have it tonight. Mr. Chair, under the previous government, wait times for both adults and children, adolescents triaged as urgent have improved substantially since 2018. The current government, when they were in opposition, claimed that some Nova Scotians had to wait over 300 days for care, which we know is simply not true. Clients on average are seen within the 7-day national wait time standard for community-based services, which is excellent news. I'm wondering, Mr. Chair, can the minister tell us what the median wait time is children and adolescents, for children and adolescents and for adults? And if there's a regional breakdown on the wait times for urgent care, I would appreciate those numbers as well.
I recognize the honourable minister for Addictions and Mental Health.
Thank you, Mr. Chair. And just the member's question. So for provincial children and adolescents, the median wait time for Nova Scotia Health is 4 days. Median wait time for IWK is 5 days. For non-urgent, which is a target of 28 days. Median wait for Nova Scotia Health is 27 days. Median wait for IWK is 57 days. In Q2, urgent median wait time for Nova Scotia Health is 3 days. Median wait time for IWK is 6 days. For non-urgent, median wait for Nova Scotia Health is 16. Median wait for IWK is 59. In Q3, urgent median wait time for Nova Scotia Health is 4 days. Median wait for IWK is 7 days. For non-urgent, median wait for Nova Scotia Health is 20. Median wait for IWK is 54. And then for adults, urgent in Q1, median wait is 3 days. For non-urgent, median wait is 37 days. Urgent, median wait is 2 days. Non-urgent, median wait is 18 days. And in Q3, urgent, median wait is 5 days. And non-urgent, median wait is 33 days. I do have just an additional comment, Mr. Chair, for the member. I do think in the time frame that she mentioned, we were in the midst of a global pandemic, right? So I think you're looking at a significant increase in presentation to emergency departments with mental health issues. I believe over 30%. I can double check with staff here. There's been significant increases with children and youth, with depression, with anxiety, with eating disorders. I know crisis calls to the autism crisis line were up significantly, so as they were with the provincial crisis line. So I think we're in many ways, I don't want to say an unprecedented situation, but we kind of are in an unprecedented situation in terms of mental health, I think, across the spectrum. That being said, I think the wait times are something I'm very focused on. So yeah, thank you.
I recognize the honourable member for Fairview Clayton Park.
Thank you, Mr. Chair. And thank you to the minister for that answer. Under previous governments, the Department of Health and Wellness has provided mental health and addictions at the health authorities with funding to improve wait time performance. So this included an investment for an investment for central intake. So that was 6 FTEs, an expansion of the community-based supports, which I believe was 35 clinical FTEs, and 9 clinical FTEs for First Nations communities. And which might, I'm not sure if would still be in, those numbers would still be in play at this point or not. I'm curious, what's the current FTE complement to reduce wait times?
I recognize the Honourable Minister for Addictions and Mental Health.
Thank you, Mr. Chair. Just to clarify with the member, is she referring to the FTEs in central intake or from a provincial standpoint? Thank you.
I recognize the Honourable Member for Fairview Clayton Park.
Both.
I recognize the Honourable Minister for Addictions and Mental Health.
Thank you, Mr. Chair, and thank the member for the question. Yeah, so in regards to new and additional services, there'll be 22.8 new FTEs focused for this. Thank you.
I recognize the Honourable Member for Fairview Clayton Park.
Thank you, Mr. Chair. And maybe the minister can clarify. So you said 22.8 new FTEs. Is that in addition, or is that the total?
I recognize the Minister for Addictions and Mental Health.
Thank you, Mr. Chair, and to the member. So that would be net new. Thank you.
I recognize the Honourable Member for Fairview Clayton Park.
Thank you, Mr. Chair. Through you to the minister, can you let the committee know how many vacancies there are currently?
I recognize the Honourable Minister for Addictions and Mental Health.
Thank you, Mr. Chair, and thank the member for the question. So the most recent data is 123 with Nova Scotia Health. I just think it's important to add, I think the health and human resource planning is something that I'm very focused on. There is an additional $300,000 too for strategic initiatives to really enhance this process. And I've had a number of very productive conversations with various mental health care professional groups across the province. So I think there's some real significant progress being made right now. Very collaborative dialogue, but I think in all of our planning, the HHR strategy is critical. Whether you're looking at psychiatry, psychologists, social workers, registered nurses, nurse practitioners, registered counseling therapists, occupational therapists. We're working very closely with Dr. Oral in the offices of healthcare professional recruitment as well. I think it's also highly beneficial having someone in his position with previous frontline healthcare experience as well when he's actively engaging in recruiting clinicians. Thank you.
I recognize the Honourable Member for Fairview Clayton Park.
Thank you, Mr. Chair. Mr. Chair, through you, can the minister tell us how many of those vacancies are COVID-19 related?
I recognize the Honourable Minister for Addictions and Mental Health.
Thank you, Mr. Chair. Thank the member for the question. Yeah, so the 123 vacancies that we previously mentioned, they would be current vacancies that wouldn't have anything to do with illness due to COVID. We wouldn't have the specificity of short-term illness for COVID specifically for mental health and addictions program in the province for staffing. Thank you.
I recognize the Honourable Member for Fairview Clayton Park.
Thank you, Mr. Chair. Mr. Chair, over several years, there's been an expansion and improvement to the crisis and urgent care services, which is probably roughly $1.6 million annually. This includes the 24/7 provincial crisis line and the mobile crisis teams that are in Central Zone, urgent care appointments for patients discharged from EDs who require quicker follow-up than MHA community clinics can provide, and ER consultations. My question through you to the minister, last year funds were earmarked to enhance provincial crisis line phone infrastructure and hire an additional 13 positions to support the implementation of urgent care services across the province. I'm curious if those 13 additional positions were hired and what work has been completed so far.
I recognize the Honourable Minister for Addictions and Mental Health.
Thank you, Mr. Chair. I thank the member for the question. So yeah, there was that was completed. There was 2 additional positions hired, and also additional 13 positions were hired to increase support of implementation of urgent care services across the province. I do think it's also kind of noteworthy from a provincial perspective to look at the development of the recovery support centers, open in Dartmouth and the Aberdeen and the acute day hospital, which are all very, I think, relative in conversation when you're looking at urgent care. And I think one of the main goals I think of the office is to try to get folks when they're in that tier 2, tier 3 space, before they reach the tier 4, tier 5 sort of crisis space. But we are kind of seeing some significant issues, whether it's from the pandemic or other issues that are kind of happening globally, that people are having significant issues that maybe have never had them before, right? So I do think these are very significant investments. Thank you.
I recognize the honourable member for Fairview Clayton Park.
Thank you, Mr. Chair. Maybe the minister could clarify. He said there were the 13 positions were filled and an additional 2. So does that mean there were 15 positions filled? Sorry, I didn't understand what he was referring to.
I recognize the honourable minister for Addictions and Mental Health.
Thank you, Mr. Chair. Yeah, just so there was 15 positions in total, I think is the question. Thank you.
I recognize the honourable member for Fairview Clayton Park.
Thank you, Mr. Chair. I'm good at math, so I didn't mean to indicate otherwise or make people assume otherwise. Mr. Chair, are we seeing a continuation in this budget for urgent care services? And what is the expected reduction in wait times with those investments? So, and I know that the minister has highlighted a number of other things that he feels will be will help with urgent care services, even though if they're technically not urgent care services. What can we expect, or what is the the hope of a reduction in wait times with these investments?
I recognize the honourable minister for Addictions and Mental Health.
Thank you, Mr. Chair. I thank the member for the question. So I think I'll try to answer this. Maybe it was a difficult question. It's kind of general, so I'll try to get into some specifics and answer a little bit more generally. So I think the primary focus is urgent care. People in crises. I think we are meeting those targets. Like when we reviewed the numbers earlier. I think an area that I really think a lot about is the non-urgent wait times. Just with my kind of experience, I guess, before becoming into this role, is oftentimes non-urgent issues can kind of turn into urgent issues if they're untreated. They're not caught early, I guess you would say, from a preventative standpoint. So I think is a goal. I mean, a very, I think, aggressive goal is to really increase access as quickly as possible across the provinces for people that need it before it turns into a crisis. But that being said, we still have to keep a close eye, I think, on the inpatient services, both for IWK and Nova Scotia Health. like a very close eye on those urgent and non-urgent targets, especially, with the, there's some preliminary sort of research to kind of just starting to see the impacts the pandemic has had, especially on our youth. So it's definitely the youth population. I mean, not just the youth population, but that's something I think a lot about. Because we do know, the vast majority of, addictions and mental health issues do kind of come to be, before the age of 25. And there's also significant investments in virtual care. So kind of looking at, virtual care can be done quite effectively with psychiatry, not just psychiatry, but also with a variety of mental health care professionals. So I think there's some pretty innovative things we can do potentially for virtual care, especially in the more rural parts of the province, because they become particularly challenging with lack of infrastructure, whether it's internet or technology for folks to even be able to access various e-mental health resources. With that being said, we have some pretty significant uptake of the e-mental health tools that we've developed over the last little bit. So yeah, thank you.
I recognize the honourable member for Fairview Clayton Park.
Thank you, Mr. Chair. And maybe we can talk about youth mental health for a little bit. Because prior to my entering into politics, my background was in mental health within the education system. And actually, my career started with preventative mental health. So we have a lot of things within the budget, within the system that we exist in, that is reactionary. Even when we talk about virtual mental health and e-mental health services, that's in reaction to, and we'll stay focused on youth because that was my background as well. So youth who have entered, who have crisis or who have addictions issues. But one of the best ways that's been proven to avoid crisis is by teaching our young people and maybe ourselves at the same time that everybody has mental health, and that mental health should be looked at the same way that we look at physical health, the same way we look at financial health, spiritual health. Most people don't wait to have a heart attack before they start looking after their physical health, watching what they eat, exercising. Most people, and I think that they're like I'll be so bold as to even put a decade on it. I think in the 70s and 80s, there was a huge push within our public school system to promote physical activity as a means of prevention, so that you would prevent some of these physical ailments that lifestyle disposes us to. So all that to say, within my life before, if we're talking about our lives before politics, my life before politics was working with primary elementary aged kids and implementing a preventative mental health program within their school system. I developed mental health curriculum with Senator Stan Kuchar for high school students. All of this to be prevention, so that you give kids the tools they need, so that when they face the crisis that's inevitably going to happen, we all face crises, they have the tools that they need to deal with them, and they can support each other and support themselves. So all that to say, is there anything within this budget, or is there anything within the Department of Education's budget that is promoting preventative mental health within our province?
I recognize the Honourable Minister for Addictions and Mental Health.
Thank you, Mr. Chair. I thank the member for the question. I actually didn't know you did that in your previous life. That's pretty interesting. Thank you for sharing that with me. I can't really speak to the education budget. I'll be just trying to get through my own this evening. But so in regards to youth services specifically, there's a just under $6 million, so $5.84 million in the budget. So I think just a couple, I think, good examples of programs that probably are very valuable and probably have to be, seriously looked at for possible, I think, expansion in the near future based on the kind of the data that we collect. But I think some of these programs, Schools Plus is a great program. So it's at all the Nova Scotia schools, kind of includes mentoring, social work, after school programming, homework, support, recreational and justice services into schools, so they can increase accessibility. I know the youth health centers, something I really think a lot about. I know a couple of the nurses in Cape Breton that do this, and it's a very busy spot to be right now in school systems in the province, much more so since the pandemic has impacted. Most of the concerns that I've been hearing from, I guess, fellow healthcare professionals have actually been around mental health in the school system, and also a lot with food insecurity and issues like that. So they're actually funded through public health, the youth health centers, but they're a health promotion, youth engagement, help navigate students. I know once got into this role, I think it's something I had expressed interest with, I guess, is having more of a synergy between public health and mental health specifically, because the two are directly related, right, in my mind. There's also the adolescent outreach services, which is funded through our office. So that's really targeted at grade 6 to 12. So the 12 to 19 years of age cohort, really kind of tries to identify poor mental health and potential addictions outcomes early, and tries to get proactive, kind of preventative personal skills building, coping mechanisms. I think, to be honest, I think, I do worry a lot about the youth right now in the province, given what's happened here in the last number of years. So I think it's something I'll continue to focus on. I do have to mention some of the great work done at the IWK, who I think I think the IWK in many ways is very much a national leader, I think, in terms of integrated youth services and kind of offering young people and their caregivers health and wellness resources and supports, whether that's through single session, individual and family therapy, wraparound supports, virtual care. So I think these initiatives with the integrated youth services are actually being implemented now. And I think it's also noteworthy that one of my first meetings was actually in Escazone at their health center with Chief Leroy and their health director at the time. And they have actually probably one of the most unique and most effective, I would say, integrated youth services models that I've probably ever been to be honest. There's a number across the country through the Access to Open Minds. So it's very much looks at, I guess, accessing supports much differently than we would in the traditional healthcare system. So it could be simple as going in to get a coffee, or going fishing, or kind of just speaking with elders in the community. It's much more, I say, destigmatizing, and much more. People are much more likely to come forward with their issues if you're not having to walk into the crisis center, I guess, to be honest. But I think there are probably a few programs I think that are worth mentioning. That being said, I think, do we have to do more? I would probably say yes. And it's something, it's not an easy thing to do, right? But something I'll definitely keep working towards. Thank you.
I recognize the honourable member for Fairview Clayton Park.
Thanks, Mr. Chair, and I'll give you a little bit more history. So I represent a riding that's in Central Zone, but my career was on the South Shore. So it was in rural Nova Scotia, where there weren't a lot of where the school really was the hub of where services could be accessed. And actually very familiar with Schools Plus, because my school was one of the schools to pilot Schools Plus originally. So it is a great program. But when you talk about the destigmatizing, or I like to say the normalizing of mental health supports, those areas within a school still have a stigma attached to them, much like in other communities. So if we really want to be normalizing, if we want to have this idea of mental health being something that we need to take care of, all of us. So there's mental illness and there's mental health, two different things. That prevention piece needs to start before high school. It needs to start before grade 6. So and I don't expect you to know anything about the education budget, but I would challenge you to have conversations with your Minister of Education, because the program that is run in the South Shore, and it's still run in certain elementary schools, is the Paths program, which is promoting alternate thinking strategies. And so that takes your primary age children, so from primary to grade 6, and it teaches them how to name and identify their feelings, good and bad, and it teaches them healthy ways to work through those feelings. And it's a whole school approach. So our bus drivers were trained, our lunch monitors were trained, our schoolyard supervisors, our parents, everybody in the school was using the same language as these kids so that they could be fully immersed in it and know that it was the norm. And it's something that's done exclusively throughout the state of New York. So every school in New York State runs this program. And again, with the hope that by the time they reach adolescence, by the time these little primaries get to grade 6, grade 7, grade 8, and crisis happens, they have the tools that they need to deal with those crises. They know, they have that skill set. Some will have it inherently, some you need to teach them, just like a times table or reading. But it is that normalizing piece, so that it's not, there's nothing wrong with you. Everybody can use this. Everybody needs to do this. So I guess maybe we'll leave that there. I'm taking away from my time, but I would challenge the minister to have that conversation with the Minister of Education and really see if this is something that could be implemented throughout across the province, because it is a tool that is there, that's easy to use, and it has tested outcomes. Anyway, we'll go back to my prepared questions. That was a little side note. And let's talk about Cape Breton, because I know near and dear to your heart. I'm an honorary Cape Bretoner. If anybody asks, I'm from South Bar. I'll tell you that story another time. There were targeted efforts to improve non-urgent wait times in Cape Breton, which continues to be an area of concern. I'm curious if the minister can let us know what the current wait times are for urgent and non-urgent care in Cape Breton, specifically for both children, adolescents, and adults.
I recognize the Honorable Minister for Addictions and Mental Health.
Thank you, Mr. Chair. I thank the member opposite for the question. Yeah, so it's something that, that's near and dear to me for sure. Once upon a time, one of my first jobs in inpatient mental health at Cape Breton. We actually had 16 psychiatrists at the time, probably about, I'm saying 9 or 10 years ago at this point. So by the time I left, we had 5. So there was significant, I'm not pointing fingers here, it's not my nature, but there was significant deterioration, I think, of the services in Cape Breton over the last decade. I am meeting with folks there on a monthly basis for sure. They're probably some of the most overworked, not just psychiatrists, but nurses and social workers and recreational therapists, and probably in the country, to be honest. Their call schedule there isn't really fair, and hasn't been for a long time. So there's some very active efforts on behalf of myself and Dr. Oral to change that as quickly as possible. So I think it is noteworthy too that there's been there's two new clinical assistants that have been were in the budget for Eastern Zone, for this budget, which the feedback with the assistants from the staff has actually been quite positive and beneficial. There's also some significant initiatives that I'm trying to do innovative things, right? It's just very challenging, not just in Eastern, but also in Western and Northern zones in the province. But just going back to your specific question, so the non-urgent time would be 144 days right now. Thank you.
I recognize the honourable member for Fairview Clayton Park.
Thanks, Mr. Chair. And so the question was actually urgent and non-urgent, and a breakdown of children, adolescents, and adults.
I recognize the honourable minister for Addictions and Mental Health.
Thank you, Mr. Chair. So the median waiting days for Central right now for adults is 4 days. Eastern it's 4. Northern it's 2. Western it's 2. And for child and adolescent, for Eastern it's 5. Northern it's 2. Western it's 4. Thank you.
I recognize the honourable member for Fairview Clayton Park.
Thank you, Mr. Chair. Mr. Chair, the Department of Health and Wellness also had a Cape Breton Wait Times initiative, which was targeted at addressing wait time performance in Eastern Zone specifically. This included wellness check-ins with adult and child clients waiting to re-triage, other brief interventions as appropriate, and offer earlier appointments with community clinicians, maximizing clinical capacity and availability of clinical teams in other areas of the province, and targeted recruitment to fill chronic vacancies. I'm curious, in response to my colleague from Sydney member 2, you said, and I quote, "I've sat across the table from them twice in the last 8 weeks, looked them in the eyes, it's going to get better, and there is a plan in place." I'm curious, is the plan the one I just outlined? And how much budget is being allocated this year to reducing wait times in Cape Breton specifically?
I recognize the honourable minister for Addictions and Mental Health.
Thank you, Mr. Chair, and I thank the member for the question. So yeah, I mentioned previously the addition of the clinical assistants, which I think will have a significant role in that regard. There's also been significant investments in enhancing virtual care, which means there can be community wait lists and non-urgent care can be actually done through virtual care. I think there's also a pretty exciting to have Dr. Barry James as the first child and adolescent psychiatrist we've actually had in Cape Breton close to a decade, I think. So, so she actually has a situation where She sees patients in person certain days a week, and also does a lot of virtual care with child and adolescents. So there's some significant investments for sure, but there's definitely more that needs to be done, and I'll definitely be working hard to address that. Thank you.
Before I recognize the honourable member for Fairview Clayton Park, it's 7:24. Just to let you know, and your time ends 7:30. So I recognize the honourable member for Fairview Clayton Park.
Thank you, Mr. Chair. And the minister, we deal in concrete items and budget estimates. It's not question period answers. So you talked about the two. So I'm going to keep on drilling down on you for actual specifics and numbers, and as they're reflected into the budget. The two clinical assistants for Eastern Zone that are allotted in this budget, you've mentioned them a few times. Have these positions been filled?
I recognize the honourable minister for Addictions and Mental Health.
Thank you, Mr. Chair. Just thank the honourable member for the question. So, yeah, so once this budget passes, the hiring process will be very rapid. Thank you.
I recognize the honourable member for Fairview Clayton Park.
Thank you, Mr. Chair. And Mr. Chair, so when they are hired, does the minister feel that this will be sufficient enough to address the current need, or how many more clinical assistants does he think are required in Cape Breton?
I recognize the honourable minister for Addictions and Mental Health.
Thank you, Mr. Chair. Yeah, no, I don't think this is sufficient, to be quite frank. It's just more of a release valve to try to alleviate some intense pressure on the clinicians there now. That being said, I think there is a great deal of value if you can get, psychiatrists and clinical assistants. It's a great environment possible for teaching. And depending on the situation, they can also work towards, full licensure themselves, right, at some point, depending on their credentials. But I think the main goal is to really get the proper complement of psychiatrists, right, and not just that zone, but also in the others as well. Thank you.
I recognize the honourable member for Fairview Clayton Park.
Thank you, Mr. Chair. Mr. Chair, has the minister entertained the usage of those individuals who are counselors? So they hold a Master's of Education in counseling. Many people within the healthcare field feel that the MED in counseling actually prepares individuals better for clinical work than an MSW does. And social workers are used frequently within the mental health system, as they should be. But again, in looking at the different roles and the different mechanisms that can be used, has any entertained around that MED in counseling piece? Those certified Canadian counselors.
I recognize the honourable minister for Addictions and Mental Health.
Thank you, Mr. Chair. I thank the member for the question. Yeah, I guess in terms of my mandate letter itself, it identified 3 specific disciplines: psychologists, social workers, and registered counseling therapists. But I'd be very surprised if there wasn't more. That I've already talked to people outside of those 3 disciplines. There's a very robust process right now that's ongoing with healthcare professionals in the province. I think that situation specifically could be interesting because they could have potential access in the school system, right? So I'd be willing to have that conversation. I think to say anything definitively at this point would probably be premature, to be honest, but I think it's an interesting point for sure.
I recognize the honorable member for Fairview Clayton Park with about 35 seconds to go.
Well, then I guess I'll just use that 35 seconds to give a shout out to my other MED counseling peeps. But in all seriousness, when you have a system that is stretched thin and you're looking for clinicians, it's important to look at the skill set that is provided by these large number of clinicians that are working that aren't always working within a school system either. And having them be under this umbrella where they are needed and can be valued. And I don't know, was that not 35 seconds?
Yeah, that's going to turn
Maybe.
here shortly. There it is, 7:30.
Thank you.
Order. Great job, member. Great job, Minister. So we're going to take a 5-minute break, and we're going to start again at 7:35 with the NDP caucus. Order. It's now time for the NDP caucus, and I recognize the member for Halifax, Citadel, Sable Island, and the time is 7:38.
Thank you, Minister. Thank you, Chair, and through you to the Minister for being here tonight. So I'm going to try to talk less and ask more questions. So we'll see how that goes. But if it seems like I'm just getting in there a little bit quick, I'm just trying to make the most of my time. So in the $20.6 million increase in mental health and addictions in this budget, I'm just going to walk through what I understand the breakdown is. So there's $12 million additional for early intervention for autism. I understand there's an increase of $409,000 for in administration, 1.2 million in addictions, and an increase in $7 million for mental health services. So with the mental health services, though, that's $7 million. What I understand is actually not much. Well, just over half of it is going into actual clinical care. So 3.1 million, that's for the 11 clinicians that are starting for virtual care, plus 8 clinicians for the IWK. And then there's 2.3 million for data collection and evaluation and analysis. So that's FTEs, as well as 600,000 for consulting and evaluation in terms of models of care. So I guess I'll start my questions off by saying, did I get the increase right in terms of the breakdown? And then my question is, can you talk a bit more, given that the most major amount is for the autism early intervention services, can you break that out a little bit? So who's coordinating this? Is this all going out to third parties for service provision? Is this going to be an ongoing increase year over year? And what evaluation do you have planned?
I recognize the Honourable Minister for Addictions and Mental Health.
Thank you, Mr. Chair. Thank you, the member, for the question. So I think I'll just go through it kind of like line by line, if that's okay. So the admin comment was for 4 new FTEs. So early intervention to IWK, so there's additional funding for the brief intensive outreach service program. I believe 370,000. I believe the member mentioned the comments in regards to autism. So that will be a new integrated model of care. So I can have more to say about that in the days ahead. For addiction services specifically, so for withdrawal management hubs, there was 1.69 million. For problem gambling strategy, 443,000. Mental health services, so the Office of Addictions and Mental Health. So there's going to be some significant research and robust data collection in regards to laying the foundational framework for that. mental health services with the IWK. Yeah, the FTEs in regards to data collection will help to guide clinical services with the IWK. 8 new FTEs to support enhanced virtual services through the IWK. Mental health services with Nova Scotia Health Authority. So through here. So implementation of data collection. So this will be analyzing FTEs and operational systems. There was 275,000 for clinical assistance in Eastern Zone. The day hospital is also included in that, integrating mental health services as well. So there's any kind of specific line item specifically that that the member wanted to ask. And I just would like to add for the funding specifically for autism will be a permanent increase in their funding. And this is going to be done through the IWK in partnership with Autism Nova Scotia. Thank you.
I recognize the member for Halifax Citadel Sable Island.
And I do think, you know, that it will be important to be clear about what the $12 million looks like. So I'm understanding that it's a new model, which means that there'll be, I would anticipate some ramp up time. So I'm just curious this year, what's the goal? How many young people will be served?
I recognize the Honourable Minister for Addictions and Mental Health.
Thank you, Mr. Chair, and I thank the member for the question. So traditionally, the office has given a grant to Autism Nova Scotia and $500,000 per year. There was also an additional $300,000 per year for 4 years for autism resource centers. So just touching on this specific question with the investment in the budget. So this would very much focus on reducing the wait list, especially for diagnostic purposes, as quickly as possible. I know I'm sure many MLAs across the province have spoken with constituents and families that often have a significant delay in diagnosis, and it puts them in a very difficult situation before their children start school. So it's really going to be trying to looking at it in a continuum of care, very much looking at the unique needs of individuals and families, not just focusing on the EIBI aspect, but also focusing on the very much a needs-based assessment that would be specific for that individual family. So this would take some time for implementation for sure. So it will be phased in this year, and I think it's exciting. I think hopefully it helps a lot of families. Thank you.
I recognize the member for Halifax Citadel Sable Island.
Thank you for that overview. And I mean, I would be the first, maybe not the first, I'd be amongst the first folks to say that, support for autism is desperately needed in this province. And I'm not going to ask you a question about this, but I am going to put out a marker that the needs for folks with autism and their families doesn't end when they start primary school. And in fact, actually where we fall down as a province is supporting people through through the elementary school years, keeping them in schools. So I do hope that if we're putting this much money in early intervention, that we keep on going, so that we think about what is the lifespan support that's needed. Elementary school, high school, transition to adulthood, that sort of thing. Speaking of phasing in, so my friend from the honorable colleague from Fairview Clayton Park spent a lot of time trying to get an answer about the $102 million pledge. I'm not going to spend too much longer on that, but so here's my question about that. Is there a multi-year plan to get to $102 million a year?
I recognize the Honorable Minister for Addictions and Mental Health.
Thank you, Mr. Chair, and I thank the member for the question. I know the universal access piece is very significant, I think, to many Nova Scotians and all of us, as representatives for sure. So I think at this point, we're very much undergoing a needs-based planning, approach, very much focusing on robust data and quantitative planning, addressing mental health addictions systems, I think, in Nova Scotia. I think something I've had a number of very productive conversations with my federal colleague and other, I would say, leading experts in the province. There's we have a very unique opportunity, I would say, in Nova Scotia to really be a leader in terms of research and development in pilots, especially. I know speaking with individuals from the Canadian Institute for Health Research, many of our colleagues in the province, I think there's some something significant there for sure. I think something that I think about is ensuring that once this begins to roll out, is that the people that need it most are getting the services first. So I think it's going to be a significant mandate item, and I hope that helps clarify the question. Thank you.
I recognize the member for Halifax Citadel, Sable Island.
That was a helpful answer. Thank you to the minister. I would say it didn't clarify the question, because the question was actually a yes or no question. But I mean, this is why I was asking also about ramping up. Like, I certainly understand the need for planning, implementing and evaluating efforts. So I know that there's $500K allocated for a study to explore this model. Is this a contract? Is it one contract? Who is it with? What work is being undertaken? And you've mentioned working with people with lived experience. So how are they being included and compensated for their work?
I recognize the Honorable Minister for Addictions and Mental Health.
Thank you, Mr. Chair. Thank the member for the question. I think people with lived experience probably bring the most value of anyone, to be quite frank, to the portfolio and to this issue in the province. I think just working as a frontline nurse in psychiatry and in inpatient withdrawal management, which is now thankfully called recovery support centers, which is much more appropriate. I think I actually like to personally talk to them myself as much as I can. I do have an extensive list of stakeholders that I would have seen over the last few months. I'd like to really be out there talking to people. I think something too that we've been hearing as we've kind of been engaging with people across the province is there's a really significant benefit to peer support. So that would be that's a potential also, not just to get a valuable insight, but also for a potential employment opportunity, right, for these individuals. I was part of a pilot project a number of years ago now in Eastern Zone, where we had peer support workers on an inpatient acute psychiatric unit. And they would actually oftentimes disclose information to the peer support workers that they wouldn't actually disclose to staff, which is very interesting. So I do see a lot of benefit to the peer support and people with lived experience. Thank you.
I recognize the member for Halifax Citadel, Sable Island.
Well, thank you for that. I'm going to repeat the questions that I asked in a minute because I didn't actually get any answers to those questions. But in terms of this idea of people with lived experience, so I mean, I think one of the things that I am worried about, and I am very pleased that you are committed to evidence-based decision making and getting the data organized. So, you know, I think in mental health research, planning, implementation, services, I mean, there's a large body of evidence that we can access. So when it comes to engaging folks with lived experience and family engagement or in lived experience or youth engagement, sorry, could I ask the members just to be a little bit quieter? Thank you. So if I think of family engagement and youth engagement, there is a wealth of research that's been done on that in this province, across this country, and around the world. And there are evidence-based standards that have been established by the Knowledge Institute on Child and Youth Mental Health in Ottawa, as well as through the Mental Health Commission of Canada. So going around and just talking to people is not engagement. It doesn't, you haven't set standards, you haven't got an organized approach, there is no way for ongoing feedback, and I think one of the really important principles around engagement of people with lived experience is actually recognizing their time and expertise and providing adequate compensation and clear opportunities. So I think, you know, I would encourage folks to pick up the standards that are available, which actually come with a whole evaluation strategy as well. So it's not even just the standards, but how you can evaluate them. And that's just based on decades of work that's been done. So once again, $500,000 to study universal mental care. Is there a contract in place with someone to lead that work?
I recognize the Honourable Minister for Addictions and Mental Health.
Thank you, Mr. Chair, and I thank the member for the question. Yeah, I think we have some of the best practitioners probably in the world at the IWK who I talk to frequently that are very familiar with family and youth engagement. I would respectfully disagree about the value of seeing having a minister talking to people with lived experience. To be honest with you, I think that's quite the opposite, actually. In regards to the specific question to the 500,000, that once the budget concludes, there will be an RFP issued. Thank you.
I recognize the member for Halifax Citadel, Sable Island.
So the current budget allocates, I think it's at 1.35 million for 11 FTEs to provide virtual crisis care through NS Health. Are those FTEs in place? And to grow to the 22 clinician promise, will there be an additional 1.35 million next year to bring it to a total of whatever that is, 2.7 million?
I recognize the Honorable Minister for Addictions and Mental Health.
Thank you, Mr. Chair. I thank the member for the question. So yeah, it'll be 1.35 next year, and it'll go up to 2.7 next fiscal. So we'll be scaling up to get to those 22 FTEs. Thank you.
I recognize the member for Halifax Citadel, Sable Island.
And is 22 FTEs the target for providing virtual emergency care?
I recognize the Honorable Minister for Addictions and Mental Health.
Thank you, Mr. Chair. I thank the member for the question. So yeah, it'll be 22.8 this fiscal plus 11 next fiscal. Thank you.
I recognize the member for Halifax Citadel, Sable Island.
Okay, and so they're providing virtual care through emergency virtual care. Can you describe how that's happening?
I recognize the Honorable Minister for Addictions and Mental Health.
Thank you, Mr. Chair, and thank the member for the question. Yeah, so they'll be doing virtual consults at actually emergency departments anywhere across the province. I talked to one of the psychiatrists a few weeks back that's going to be doing this, especially in underserviced regions. So it's really be a very innovative approach, actually, to hopefully, especially to help people that are kind of in a mental health crises or in an acute situation. Thank you.
I recognize the member for Halifax Citadel, Sable Island.
Thank you very much. And the minister referenced, an innovative approach. And I guess one of the things that I'm concerned about, and this isn't only in Nova Scotia, but there's some specific Nova Scotian aspects to it, is just really understanding how we're getting the evidence that we base our programs on. So we do have amazing researchers. I can give a shout out to my PhD committee who do a lot of work in mental health in this province. And so I would not dispute that at all. But at the same time, how that actually gets translated and what we understand is a complex process. So for instance, we are talking about increased mental health needs because of the pandemic. Actually, the research so far is inconclusive about what that looks like. I think eating disorders is clearly, those have increased, but actually a bunch of studies just came out that were pulled together in a synthesis that looked at youth and child and youth suicide actually decreasing in Canada during the period of the pandemic. So, first of all, a lot of times you have to take it all together and have experts understand it, parse it out, understand what it means for methodology, but then also we're not even out of the pandemic. So I guess I worry when I hear, sort of different things are bandied about because I'm not sure that the evidence supports them. And so I guess I would ask, you talked about increasing the research capacity, I think I understood within the office, or increasing the research and data analysis. How does your team connect with emergent research, like peer-reviewed research, and how is that deciphered into programs and policy in the office?
I recognize the Honourable Minister for Addictions and Mental Health.
Thank you, Mr. Chair. So for fiscal 22-23, there'll be an analyst, routine outcome monitoring, industrial engineer, data coordinator, data analysis, data collection. I just think I should say too that I think there's some highly qualified and very respected individuals, not only just within government, but within our province, that we do, I think, have a very good collaborative, open, productive dialogue with. In regards to the impacts of the pandemic, I don't think they would have helped people's mental health, just anecdotally speaking. I think it's probably a little bit early to conclude what the research is going to say. But I'm not sure if the member was trying to say that the pandemic had a positive impact on people's mental health. I'm not too sure. That kind of seems strange to me. But nonetheless, thank you.
I recognize the member for Halifax Citadel Sable Island.
Thank you. And I just want to clarify what I was saying, because I definitely don't want the minister to put words in my mouth. What I was saying was that we need evidence-based mental health care. That's what we haven't had here across the country, globally. That's what a lot of people are working towards. And so when I'm not, you said anecdotally that the pandemic, I'm not working in anecdotes. What I want to say is that we can't presume until you have an evidence base what the effect has or has been or hasn't been. So I'm certainly not pronouncing on it. I'm telling you what I've read and what I've looked at. But certainly I would encourage you to have people within your department who can look through the longitudinal studies, look through the data synthesis, and develop information that's useful for your department. And on that sort of note, so the Universal Access Promise was about updating MSI billing codes to provide universal access through private providers. So before the election and during the election, I think that was sort of how you understood the problem of mental health in Nova Scotia, or how the party, understood the problem of mental health in Nova Scotia. Has there been any thought in actually bringing this together in a comprehensive mental health strategy that not unlike the one that the Liberals stopped implementing in 2014? Because that was really a structured approach to bringing together, a vast amount of communities and community organizations, folks with lived experience, clinicians, and the advantage of having a strategy that it sets out some key principles and some goals instead of sort of throwing spaghetti at the wall with a bunch of different activities.
I recognize the member for Halifax Citadel Sable Island with an additional question.
I was just going to summarize what I had said. Has there been consideration of a mental health strategy?
I recognize the Honourable Minister for Addictions and Mental Health.
Thank you, Mr. Chair. Thank the member for the question. So the universal addictions mental health specifically, there will be a strategic plan and framework that will be laid out in the near future. It just takes a bit of time. It's very significant, right? So I don't want to take this lightly. I know I do get asked this question a fair bit, which is totally understandable. I know it's very important to many people. But part of the research and the quantitative, data collection will give us the strategic direction, not just for this year or next year, but hopefully for the next, future, right, for Nova Scotia. Thank you.
I recognize the member for Halifax Citadel Sable Island.
I was pleased to hear you talking about integrated youth services. I think I do want to clarify that there's no way we're the first jurisdiction in Canada to have integrated youth services. In fact, the fact that we are lagging behind nationally was one of the reasons that I chose to study integrated youth services in my PhD research. So I think they hold enormous promise. I think that there is, a couple decades of research that's gone into this. and nationally and internationally. I think there's been robust data collection, for instance, through the Access Open Minds. I'm just going to make sure the minister. Okay. There has been robust data collection through the Access Open Minds project that will certainly be helpful. So I know that the IWK is leading an initiative to implement integrated youth services in Nova Scotia. They recently posted for a senior position to lead that work. One of the key principles around integrated youth services is actually providing services that span the developmental period of youth. So in general, in Canada, 12 to 25 years old. And so this will require, in Nova Scotia, the collaboration of Nova Scotia Health with the IWK. How is the office involved in supporting the establishment of integrated youth services, and particularly the focus on the youth developmental period?
I recognize the Honourable Minister for Addictions and Mental Health.
Thank you, Mr. Chair, and thank the member for the question. Yes, we have a significant partnership with very frequent and ongoing dialogue. I just asked the department to get the investment figure for integrated youth services, but I can maybe review some of the specifics with the single session individual and family therapy. So that would be support that meets you where you are. So families can walk in and receive virtual individual or family session with a healthcare professional. The investment's $1.3 million, so just for the member. There's also wraparound supports available. So this will be a hub that will provide opportunities to improve access at one location. So primarily primary health, DCS, justice, education, community-based organizations will join the hub. So it very much kind of creates a suite of services in partnership with the office. There's also evidence-based child and adolescent services, websites, and helpful mental health and addictions information, which is in a digital knowledge hub, so virtual interventions, which can be provided by professionals. There's also coordination, outreach, and matching to appropriate services. So there's us to provide assistance, finding resources and supports that are right for the youth and the caregiver, really focusing on the unique needs of the family and individuals. Outreach services to support improved function in the community and overall wellness. There's also a peer support aspect. The peer support will include social and emotional support and empathy, regardless of circumstances, and is delivered through groups and workshops with also an option for one-to-one. And the last part is the supporting others aspect, which will partner with community groups, primary health and caregivers to kind of provide tools and tips just upon if you are exiting the program. There's also a steering committee that's run actually in partnership with the office for collaborative feedback. So the IWK, the mental health addictions planning team and the office come together to really try to ensure that these services really go right across the lifespan. Thank you.
I recognize the member for Halifax Citadel, Sable Island.
Thank you, and thank you to the minister for that answer. So I want to make sure that I understand. So the 1.3 million, is that going to support the IYS effort at the being led by the IWK?
I I recognize the Honourable Minister for Addictions and Mental Health.
Thank you, Mr. Chair. And yes, yes, that's right, to the honourable member. Thank you.
Oh. I recognize the member for Halifax Citadel, Sable Island.
And so I'm wondering if the minister can also clarify if the minister and the office are committed to an integrated youth service system in Nova Scotia that spans 12 to 25 years old, or whatever youth definition you want to use. And will the steering committee include family engagement and youth engagement?
I recognize the Honourable Minister for Addictions and Mental Health.
Thank you, Chair, and thank the member for the question. Yeah, so I think there'll be a very thorough and rapid evaluation of this integrated youth services model to IWK. Something I'll be watching very closely. I think the family engagement piece will be critical. So it's something that I think would be very important as we move forward. Thank you.
I recognize the member for Halifax Citadel, Sable Island.
I might come back just to really understand if we're going to talk about 12 to 25-year-olds, because in Nova Scotia that requires, some deep collaboration between Nova Scotia Health and the IWK. But maybe I will come back to that question at a later time. So I wanted to ask about the one-time investments that were made through the Mental Health Foundation from year-end funds. I'm wondering if you can speak a bit about, you're talking that they're, going to be given to organizations that serve equity-deserving populations and communities. But how will that actually be mandated? How will that be monitored? And how will the priority be determined, and what will be the evaluation of the provincial investment?
I recognize the Honourable Minister for Addictions and Mental Health.
Thank you, Mr. Chair. I thank the member for the question. Yeah, so in order to provide that funding, I made sure there was a pretty extensive accountability framework in place, which will have to be reported back to me in the department on a quarterly basis. And there was made very specific mention that it should be targeted for specific groups that need the supports the most: African Nova Scotians, First Nations individuals, 2S LGBTQ+, newcomers, and people in vulnerable situations. I think if you actually reviewed some of their grant recipients in the past, it's quite an extensive list. I went through every single one of them before I come up with a decision to provide the funding. They did work with ranging from eating disorders to early psychosis, to work with African Nova Scotian communities, the Canadian Mental Health Association. They do extensive work. And the office also provides funding to groups as well. So I just really thought there was a time sensitivity to get the money to these groups. So I'll be looking forward to that accountability framework, and I'll be very focused on that. Thank you.
I recognize the member for Halifax Citadel, Sable Island.
And thank you to the minister for the explanation. I'm pleased to hear that there is an accountability framework in place to guide and monitor the investments. Just to clarify, are people being given 1 year funding from the year-end funding that was given to the foundation? Not people, organizations.
I recognize the Honourable Minister for Addictions and Mental Health.
Thank you, Chair, and I thank the member for the question. Yeah, this was a one-time investment. That being said, based on the accountability framework and based on the feedback from communities, community organizations that received the funding and the impacts it has had in their communities, we'll definitely be reevaluating that. But this was a one-time funding. Thank you.
I recognize the member for Halifax Citadel Sable Island.
Thank you. And I mean, I do hope that as the IYS model is developed and you start thinking about, I can't remember, was it called a mental health strategy, a strategic plan, that, the role of community-based organizations will be considered, and to really move organizations off the 1 year funding cycle, which is really just so difficult for community-based organizations to make plans, to develop programs, to evaluate them. I mean, basically, you're not really getting evaluation data. You might get bums in seats, and sorry, I don't say bums, but you're not getting long-term changes from a 1 year program, or at least you're not able to measure them or quantify them. So I think it's really important to think about longer-term funding frameworks that allow communities to build capacity, to build programs, and to actually see programs through that have long-term impacts. Can the minister speak about what diversity, equity, and inclusion analysis is undertaken on the policies and programs of the office?
I recognize the Honourable Minister for Addictions and Mental Health.
Thank you, Mr. Chair, and thank the member for the question. Yeah, the Department of Health and Wellness is putting some significant work into equity and engagement consultation piece that will be completed in order to really develop an extensive health equity framework. Just touching back on the previous question, just I think it's kind of important. Within the office, we are actually going to be hiring a community liaison officer whose specific job will be to work with community-based organizations across the province, because that was in my mandate. I think I would agree with the member for sure that these groups play probably much more of a significant role than we realize, to be honest, with addictions and mental health care across the province. I think I speak to a lot of these groups, and they do have issues with core funding, which is something we will look at, as things progress based on the accountability framework. Yeah, thank you.
I recognize the member for Halifax Citadel Sable Island.
Thank you. And I had a chance to speak with the Minister of Health during estimates and talked a bit about the Office of Diversity, Equity, and Inclusion that is being established at the Department of Health and Wellness. I think, back when I worked in the provincial government, so in 2008, 2009, there was a specific EDI consultant at the Department of Health and Wellness who was looking at 2S LGBTQ plus communities and health issues. Within the current office, there is no such mandate. I'm wondering how the Office of Addictions and Mental Health will ensure that that gap is filled in their analysis.
I recognize the Honorable Minister for Addictions and Mental Health.
Thank you, Mr. Chair, and thank the member for the question. Yeah, so I think, as this equity and engagement framework is developed, the engagement and consultation of 2S LGBTQ plus individuals, and also, with individuals in Nova Scotia that have had difficulties accessing healthcare services will be consulted. And so I think that's going to be part of that process. Thank you.
I recognize the member for Halifax Citadel Sable Island.
Thank you. I wanted to talk about the new mental health day hospital model. And I guess I have a number of questions about the day hospital. So in terms of budget allocation, I'm wondering if it is $1 million total, because I'll be honest, I think that seems low. So I'd be curious what the actual annual cost of the day hospital is. I'm wondering what the difference is between the other day treatment programs that have been traditionally offered, like at the Abbey Lane and HRM, for instance. Or, I know that the Fisherman's Memorial, I think, closed, but they also had a day treatment program. So what's different about this new day treatment program? How many people do you plan to
Order.
work?
Please refrain from using you.
How many people does the day hospital plan to work with over the course of this coming year? And I also have some questions around how care will be managed. So for instance, that model relies on people being able to go home at night. And so how will the program support people who either don't have safe and secure housing, or I can imagine a scenario where someone comes to treatment and actually isn't safe to go home that night. And we know that the inpatient units are at 100%. So what's the planning around, that sort of scenario?
I recognize the Minister of Mental Health and Addiction.
Thank you, Mr. Chair, and thank the member for the question. I went to the day hospital last week, met with senior leadership and clinicians toward the unit. All positive feedback thus far from patients and staff, which is good. There will be a very thorough evaluation on clinical outcomes and readmission and those sorts of things. The investment's just a little bit over $1 million. So that would include a new psychiatrist. That was, I think, 360. There's also funding there for registered nurses, social workers, and support teams. So basically, you would have the flexibility of kind of receiving intensive inpatient services for 12 hours a day, whether that's psychotherapy, whether it's pharmacology, whether it's specific programming, individual programming or group programming. If there's a deterioration in condition, where its proximity is close to the inpatient unit, you could just be readmitted. And if you needed to step down, you could also be stepped down or connected with some community-based resources. So it's very much kind of in line with the recovery support centers. Even though they're more focused on substance use disorder and gambling, it's very much we're kind of looking at things in a continuum of care. So you can have a suite of services, basically, on one side being the most intense, and the far left would be, the tier 1, tier 2 sort of individuals. So I think in terms of cost effectiveness in healthcare, as we all know, it's quite cost effective. I know there's been speaking with some of the kind of leaders in our province in regards to kind of helped us with this. They've seen some pretty significant research in the UK and other jurisdictions that have had these places for some time. I think another part of it is that it will alleviate significant strain on inpatient beds in the other 3 zones, and also impact directly and indirectly, I guess, EHS transfers and hold up setting emergency rooms because we do have a provincial bed management system. So if we have 100% capacity in central zone, that means some of these individuals are going to be going to one of the other 3 zones for admission, right, away from their families and friends and that sort of thing. I think what's challenging with the day hospitals, it's we have very rural parts of the province too, right, which offer their own unique challenges for people that are acutely ill at times. So we have to be very, I think, thoughtful and innovative for other parts of the province. But I do think in the urban centers, especially, there's really a high level of effectiveness in helping people for relatively cost efficiency purposes. Thank you.
I recognize the member for Halifax Citadel, Sable Island.
And you, thank you to the minister for that answer. So it seems like it's designed to meet people where they're at, but at the same time, I guess I'm wondering, are there what's the eligibility and how do you judge when it's time for somebody?
Order. Please refrain from using you.
How do the clinicians judge when it's time to discharge someone? And what about support with things like transportation, food security, substance use, and things like that? Is there an income replacement or funding for childcare?
I recognize the minister.
Thank you, Mr. Chair. I thank the member for the question. In regards to sort of clinical subjective decision-making processes, I think that would probably depend on the individual clinician, for if they need inpatient admission or if they're appropriate for discharge. I can't really speak to that. I think one of the key things that I wanted to see in these, not just in the day hospital, but in the 10 recovery support centers that we're going to be standing up across the province, is that people can actually get a suite of services when they go there, including, whether it's DCS, whether it's justice, whether it's, food security. I really want, it's an access point to really connect you with the other departments of government, I guess, that you would need in that way, because oftentimes things are much too siloed. I think the accessibility piece is important too. I think with the recovery support center, especially in Dartmouth, which I think is a very positive thing that you don't often see in addictions and mental health care, that you can actually just walk in, which is quite unique and highly beneficial. So I think increasing accessibility and self-referral is something I think that we should probably continue to focus on. I hope that helped answer the question.
I recognize the member for Halifax Citadel, Sable Island.
Thank you, and I'll be back with more questions, but for the moment, I'd like to cede the remainder of the time to the honourable member for Cumberland North.
Okay. I recognize the member for Cumberland North, 8:32.
Okay. How much time?
8:38, 6 minutes.
Oh, 6 minutes, okay. Thank you, Mr. Chair. And I don't know if he's listening or not. Okay. Hello, Minister. I just have 6 minutes, so I'll just probably get one question in. But I'm wondering if I guess maybe at first I'll just ask a more overarching, bigger question, and that is, I didn't know until the budget estimates came out that the Office of Mental Health and Addictions is actually under, I think, Service Nova Scotia. Is it Service Nova Scotia? I think. Yeah. It's not under health. Yeah. So I'm wondering how you work with the Department of Health. How does the sort of the relationships work? Because your office is dealing with inpatients, outpatients, community care, and just wondering if you can explain the relationship with the Department of Health, and do you have, if some of my constituents are having trouble accessing a psychiatrist or acute mental health service, if it's hospital-based, should we be contacting the minister, or should we be contacting the Minister of Health and Wellness?
I recognize the Honorable Minister for Addictions and Mental Health.
Thank you, Mr. Chair, and thank the member for the question. Yeah, I think we're in a little bit of a unique situation. We do have three ministers in the health portfolios, which is something new, in the history of the province. I think the way I look at things and the way I've spoken to my colleagues, which is quite often, is anything under the purview of addictions and mental health, I take responsibility for that in the province. So anything related to psychiatry, addictions, mental health, I would say probably it would be me, to be quite honest. That being said, Minister Thompson is just down the hall for me. We talk quite a bit about various issues and have very close contact. There's also significant frequent dialogue with public health also, right? Because they have a significant role to play in health prevention and promotion and stigma reduction, those sorts of things. So I hope that helps answer the question.
I recognize the member for Cumberland North.
Thank you, Mr. Chair. I feel better because I was concerned about where the minister's department was not under health. I was worried about if there was a disconnect there with the other health. So that's reassuring. There's so many questions I could ask. I did have concern with a couple of things that the minister said in the opening statement, and one in particular that really stood out to me was that no one gets turned away and that there's acute care beds for anyone in need. And I hope, I want to be great if the minister was able to come up to Cumberland sometime and meet with some of our stakeholders like law enforcement, those that work in addictions and mental health in Cumberland, because that certainly is not the case in Cumberland. And because we rely on Truro, for our acute care beds, and there's most often none available, then most of the time our emergency room docs are not able to provide acute medical care to those in mental distress. In fact, I just got a call last night around 11 o'clock from a very distraught mom. And so we definitely need a fix for those acute mentally unwell patients, especially the ones that are going through a psychosis or maybe suicidal. And we see this in all ages, Minister, including teenagers. Very, very concerning. And the IWK is a similar situation. We had a young teenager sent home, even though she said she was scared she was going to harm herself. Same thing, she was discharged back to the community with no support services in place. So I want to make sure the minister is aware that those comments are not true for the people of Cumberland, and we definitely have a deficiency in acute care mental health services. And I've spoken with Sam Hodder, and initially the concern was there's not enough housing. That is true. But what we're talking about, even if someone had housing, there's still a huge deficiency. And people are, I'll give you one example, this is a visual. We had, this would be common where a paramedic would bring somebody up to the hospital that has been deemed unsafe by law enforcement or someone in the community, like a physician, and before the ambulance leaves the driveway of the hospital, the patient has been discharged and is walking out the door because they've not received medical care. So, and often it's because the emergency department cannot provide the care that is needed. So I just want to make sure that the minister is aware of these very real deficiencies that we hear about in our office, sometimes daily. And it's very awful as MLA, but even worse when you're the parent, when you cannot find the support and the help that is needed for your loved one. So,
Thank you, member. Thank you, Minister. Order. The time has run out for independent member at this time. I will pass it to the official, back to the official opposition. And I will ask, I recognize the member for Cole Harbour, Dartmouth.
Good evening, Minister. You certainly do have your task cut out for you, but it's one that is critical too, especially in Nova Scotia. And it's addictions and mental health is very cyclical. You have addictions, you have mental health. You go back to addictions. It's a circular problem. And to quote you, you want to do it once and do it right, and you want to get everything done correctly. I know the members that spoke earlier asked great questions, but so from my understanding, the budget is pretty much you're starting fresh, as to what you're establishing this ministry for. You need to do research, data collection. Once the budget is passed, and the RFP will go out, and you start from there. But in your profession, former profession, data must have been collected at that point, and I just wanted to ask, technically, you do have some data to start from. You're not just starting with a blank page and creating, a data bank of patients and the needs. And I recall the conversation initially was to have like a helpline, and I missed the beginning of your entry, and I didn't know whether you mentioned that. Has that been scrapped? Is that still the plan going forward?
I recognize the Honourable Minister for Addictions and Mental Health.
Thank you, Mr. Chair, and thank the honourable member for the question. Yeah, so I think when you kind of talk about the starting fresh aspect, I would say that would be specifically pertaining to the universal access piece. We do know we have significant quantitative and qualitative data, across the lifespan, I think, for many Nova Scotians and addictions and mental health. Whether you're looking at depression or anxiety or schizophrenia or, psychosis. We have some of the best, I think, researchers in the country, actually. So the foundational aspect for the universal piece is kind of what I would be referring to. In regards to the crisis line, we do have a provincial crisis line, 1-888-429-8167. I think what the honourable member was referring to probably was the 3-digit crisis line. So yeah, there's a significant review right now within the federal government and the CRTC examining the feasibility of that. So that's something we're doing in partnership right now. The 3-digit line is something we'll have more to say about, I think, in the future. It's something I think has to be done, to be quite frank. I know when this is a little bit off topic, I suppose, but this was done a number of years back in the United States, actually, and they had an exponential increase in call volume, for example. So I think there's not just there has to be significant planning too with your human resource component. There has to be very thoughtful transition between the current crisis line and the new crisis line, just to ensure that people have accurate information before they're in a crisis. I hope that helps answer the question. Thank you.
I recognize the member for Cole Harbour, Dartmouth.
And so you'll see the reason I asked is because you did mention, you said about referring to urgent and non-urgent, and so therefore the people on this other end of the phone will be determining the urgency or not. And I think you said earlier that many think they need mental health, but they don't. And in that regard, I just wondered how the assessments are going to be done, because it's been my experience, anybody that truly has a mental health issue doesn't seek help many of the time. So I just wondered how critical and how you're going to actually do these intakes of assessments. Someone picks up the phone and starts talking. How do you do the assessment, and who's going to do the assessment?
I recognize the Honorable Minister for Addictions and Mental Health.
Thank you, Mr. Chair, and thank you to the member for the question. So yeah, so when you call a central intake, there'd be a highly trained, highly qualified mental health care professional on the line who would actually do a very thorough, what we call intake, and would actually triage you on the phone based on their intake. I mean, having done these in an inpatient setting myself many times, I mean, you're looking at everything from appetite to sleep to relationships with family, medical history, substance use history, just general demeanor, suicidal ideation. It's a very thorough and comprehensive assessment. In my experience, just speaking with many of these clinicians, is that if there's ever a seed of doubt, they always usually err on the side of caution in regards to an intake, just to ensure the safety of the individual. That being said, I think if anyone's ever, I mean, in an acute crisis, they should either call 911 or call the crisis line that I stated earlier. I think, yeah, I think the training for the individuals that do that is really important. There's also, I think, a significant piece in regards to mental health literacy, probably for all of us, really, for myself included, just to try to develop, I mean, open and honest dialogue, you know, with our communities, especially with our community-based organizations. So hopefully that helped answer the question. Thank you.
I recognize the member for Cole Harbour Dartmouth.
Thank you. 141 Nova Scotians died by suicide in 2021 alone. Many more tried. And you toured the province and heard firsthand, I believe you participated with the Minister of Health during the tour, and you heard firsthand how mental illness and trauma is at a critical level in our province. Are you prepared to take immediate action to ensure people in crisis get the help that they need now, when and where they need it?
I recognize the Honorable Minister for Addictions and Mental Health.
Thank you, Mr. Chair, and thank you to the member for the question. Yeah, I think they're very, you know, staggering statistics, right? When you talk about suicide and people, you know, losing loved ones, it's, you know, very, very difficult. So I think something that was actually done this winter, which I think is significant, was the mental health and suicide research survey that was done online. So we actually were able to collect fairly robust data from over 7,000 Nova Scotians, speaking not just with their thoughts with suicide, but with their perceived barriers to treatment in the system, potential issues that they see in their communities. So there's a very actually robust analysis of that undergoing right now. That's actually with public health. So it's and kind of, I think, you know, long term, something I would like to see is a very thoughtful approach to stigma reduction, across the province. It's a very difficult thing to do, but I think we have to, have to try for sure. In regards to, urgent care, we do have, inpatient beds, high acuity units for people in acute crises states for sure. Then we have, our, day hospitals, recovery support centers, across the province, and also outpatient community-based clinics and things of that nature. So I think there's a really vast array, I think, of services. But I think we definitely need to do better for sure. Thank you.
I recognize the member for Cole Harbour, Dartmouth.
Thank you, Mr. Chair. So you did some data collecting of 7,000 and you now understand the barriers to treatment. Is that a public document? And what were the top barriers to this treatment?
I recognize the Honourable Minister for Addictions and Mental Health.
Thank you, Mr. Chair, and thank the member for the question. Yeah, that actually sits with public health. I know there would be some highly sensitive and confidential information there with the survey itself. So I think we could reach out to them and hopefully follow up with the member. Thank you.
I recognize the member for Cole Harbour, Dartmouth.
So you touched on rural Nova Scotia, and it was discussed earlier, but those living in rural Nova Scotia must travel hours to access mental health clinics and counselors. A day clinic in Halifax, many feel, is not the answer for Nova Scotians. And the hotline number, the number that they're feeling, people feel it, that's scripted responses, but where is the government's suicide prevention strategy in the budget, and when will it be acted upon?
I recognize the Honourable Minister for Addictions and Mental Health.
Thank you, Mr. Chair, and I thank the member for the question. So in January of 2020, the province renewed its suicide prevention and risk reduction framework. These are actively continually to be monitored. So there were 6 key areas for action: improving suicide-related data monitoring and evaluation, extending access to services and supports in the community, addressing targeted social issues that would be identified as increasing risk, strengthening upstream prevention and promotion, and identifying and supporting populations at risk. So I think there's also worth noting that it's we do have a provincial crisis line and the kids help phone, which I think are significant. I think the comments, the rural comments are quite accurate, to be honest. I think especially Nova Scotia, where they kind of have, especially for youth, with the IWK and where it's located. I think anyone that's ever been there, I've had my son there when he was just 18 months old. It's world-class care. I think the issue we have is we need to figure out innovative ways to provide these services for youth in the other 3 zones, right? To be honest. So that's the kind of conversations we're engaged in. Yeah, thank you.
I recognize the member for Cole Harbour, Dartmouth.
Thank you, Mr. Chair. And you did bring up the IWK quite often in your responses, and it is a great facility and I had a child that attended for mental health services, but I realized once they turn 16, that's their business case. They don't have patients, they don't see patients after they turn 16. Is there a plan to transition people who are seen for mental health at the IWK after they turn 16? Where do they go from there?
I recognize the Honorable Minister for Addictions and Mental Health.
Thank you, Mr. Chair, and thank the member for the question. I think my understanding is that IWK would look after individuals until they're 19. I can double check with the department here. But there's also actually what's called a transition policy in place where there would be, if you're turning 20, for example, you would have a concrete plan in place, whether it's between clinician to clinician or community-based service to community-based service. There should always be a thorough discharge treatment plan if it's going, whether it's going out of the healthcare system or whether it's going to a different practitioner. Thank you.
I recognize the member for Cole Harbour, Dartmouth.
So to go back to the intake, and when someone wants to be seen for mental health, they still can go to their family doctors and go that route as far as being assessed and being referred? Or is that what we want to get away from, or do we want to complement it with the new method of reporting and getting people seen?
I recognize the Minister for Addictions and Mental Health.
Thank you, Mr. Chair. I thank the member for the question. Yeah, I think that's the short answer is yes. The family doc usually would have to consult psychiatry. They would have to, then they would be able to determine if they required inpatient hospital admission. I know in my experience, that's fairly rare, something we would classify as a direct admission. Typically, people that need high acuity services to the point where if they would need an inpatient admission, often the point of contact is crisis at the emergency room. So that process would involve a medical clearance from an ER doctor usually. Then there would be a thorough assessment by the crisis team, which is typically a social worker, a nurse, and a psychiatrist. And both those social worker and nurse would have significant experience and additional training in crises. And then it would ultimately be up to the psychiatrist to determine whether it facilitates an inpatient admission. I think one of the gaps that I've seen over the years is when you get to a situation where the person doesn't really meet the criteria for an inpatient admission, but they don't have adequate follow-up in the community. So I think that's something that I think a lot about, because oftentimes if you get people appropriate care at the right time, you can kind of, I want to say nip it in the bud, but you can kind of get things at a point before they kind of snowball to the point where they need a hospital admission, usually for weeks before they kind of feel well. But I think the family doctor component is one part of it. I think you're seeing a lot of desire for expansion of scope of practice too of other disciplines. I know whether you're talking about social workers, occupational therapists, traditional disciplines that wouldn't necessarily have seen in the space of addictions and mental health. So I think we need to look at these disciplines. I know there was I've had some interesting conversations with pharmacists. There's something simple as kind of just speaking with patients coming in for their medication to kind of assess symptoms and side effects, so that you would be able to avoid, unnecessary ER family doctor visits, just kind of small things like that. I think they would have cumulative effect. Thank you.
I would like to recognize the honorable member for Fairview Clayton Park.
Thank you, Mr. Chair. I'd like to speak to the minister about recruitment and retention. I'm curious if the minister could let us know what the current staff complement at NSHA and IWK is that delivers mental health and addiction services. So the full complement of licensed professionals offering services.
I'd like to recognize the Honorable Minister for Addictions and Mental Health.
Thank you, Mr. Chair, and thank you to the members. So the IWK is 384 FTEs. Nova Scotia Health is 1848. And I do not have a discipline-specific breakdown. Thank you.
I'd like to recognize the Honorable Member for Fairview Clayton Park.
Thank you, Mr. Chair. And if the minister could let us know the current vacancies at NSHA and IWK within these FTEs.
I recognize the Honorable Minister for Addictions and Mental Health.
Thank you, Mr. Chair. I thank the member for the question. So Nova Scotia Health is 123 and IWK is 10. Thank you.
I recognize the Honorable Member for Fairview Clayton Park.
Thank you, Mr. Chair. Mr. Chair, there's $140,000 to add 4 psychology residents between Nova Scotia Health and the IWK. Are these doctors currently in the queue and waiting for contracts?
I recognize the Honorable Minister for Addictions and Mental Health.
Thank you, Mr. Chair, and thank the member for the question. Yeah, so these 4 residency seats are in the budget, right? So once we finish up at the budget, we'd be able to very actively recruit. I think something I definitely noticed as a significant gap is there's only 5 PhD clinical psychology seats at Dalhousie in the province of Nova Scotia, right? Which is interesting. So I think this is a welcome addition. I know that I've had some frequent conversations with Dr. Oral and my colleague and the Minister of Advanced Education, kind of not just in regards to psychologists, but just in regards to potential training opportunities for other professions. But that's the specifics with this one. Thank you.
I recognize the Honorable Member for Fairview Clayton Park.
Thank you, Mr. Chair. And in these conversations, has there been any discussion as to where these doctors are or where these psychologists are coming from and where they're going to go?
I recognize the Honorable Minister for Addictions and Mental Health.
Thank you, Mr. Chair, and thank you to the member. I guess the long story short, I just want to get them to Nova Scotia, right? And then once we get them here, we can, ideally, people, if they're domestic, that's great. If they're international, that's great. We just, with the HHR demands in our current healthcare system, not just in addictions and mental health, but also in primary health and seniors and long-term care, we have to be very innovative in recruitment and retention, whether that's domestic, whether that's in other provinces, whether that's international. So I think there will also be a significant review right now through the Office of Healthcare Professionals and Recruitment to identify areas of particularly high demand. And I'm just using, psychiatry as an example. And we have identified, demand in Eastern and Northern. I know speaking to many folks in Western Zone, there's a real demand there for addictions services, right, that need to be increased. So I think that the needs will be thoroughly assessed, but I think the most important part is just to get the practitioners to the province. Yeah.
I recognize the honourable member for Fairview Clayton Park.
Thanks, Mr. Chair. And I will note that there is more money to hire clinicians and a really heavy focus on recruiting psychiatrists and psychologists, the professionals that Nova Scotians with complex mental health needs need, especially, the vacancies and the need that in all health zones, including Eastern, which is what we talked about earlier. The Mental Health Foundation has said in reflection to this budget that most mental health challenges are related to depression and anxiety, and would be better served by community-based practitioners from a variety of disciplines who are equipped to address the broad spectrum of biopsychosocial needs, and that there is no new funds to expand collaborative community health centers, which would have been, in their words, quote, fundamental to addressing physician retention, unquote. And we talked about a few of those disciplines. So my question to the minister, through you, Mr. Chair, why were there no funds earmarked for this key retention strategy?
I recognize the honourable minister for Addictions and Mental Health.
Thank you, Mr. Chair, and I thank the member for the question. That was an incredibly complex and very dense statement. I think there's a lot of very valid points in there. I think the premise is probably some truth to the premise of that. I think setting it up in practicality takes a bit more time and effort and stuff. But I think the collaborative care model and the community-based treatment model is, I see a great deal of value in that for sure. I think it's just there needs to be a really significant focus on the tier 2 and the tier 3 services, right? Like we don't necessarily need, I guess more money doesn't always necessarily lead to more effective clinical outcomes, addictions and mental health specifically. With the tier 2 and the tier 1 community-based organizations play an important role for sure. I think the access piece in communities is definitely, I probably agree with that. I think the very comprehensive process to institute the measures that they would have referred to in that statement. Thank you.
I recognize the honourable member for Fairview Clayton Park.
Thanks, Mr. Chair. And I by no means in my original statement are saying that more money is needed. I was pointing out that the budget, as it's laid out, as it's presented, is very focused on psychologists and psychiatrists. So money for those disciplines. When the Mental Health Foundation talked about community-based practitioners, so looking at a wide variety of disciplines. So the question isn't, why aren't you putting even more money in? It's why hasn't money been earmarked for those types of clinicians? It's not my words, it's the Mental Health Foundation that has said such. So again, is that something that will come? Is that something that can be presented mid-through? I'm just curious why the money wasn't earmarked for that type of community-based health centers.
I recognize the honourable minister for Addictions and Mental Health.
Thank you, Mr. Chair. Thank you to the member for the question. So there's an extensive quantitative needs-based planning that's undergoing right now to really ensure that each clinician, regardless of their discipline, is maximizing their scope of practice. Typically, the the psychologists and psychiatrists of the world typically treat the very sick people in society, generally speaking, which they need that treatment at that time. There's a variety of disciplines that in the other tiers, before that also play a very valuable role. I think some of the significant investments in community-based organizations, such as Tejikamic, for example, are very significant because they really let the community guide, the framework. Thank you.
I recognize the honourable member for Fairview Clayton Park.
Thanks, Mr. Chair. Mr. Chair, one of the key drivers of universal mental health and addiction coverage that was outlined in the government's election platform, but not in this budget, is around billing codes. So at the time, the government said true universal access private practitioners will, of course, still carry on their traditional practices, but it will allow them to take on clients knowing that MSI will pay them a fair rate for services rendered. But a few months later, Dr. Sam Hickox, who's the chief of the Office of Addictions and Mental Health, told the Standing Committee on Health, and I quote, "We are going to be very mindful on initiating a pilot that will examine the question of whether billing codes are the most appropriate and effective way to remunerate clinicians. Billing codes, they're on the table. Exactly to what degree, that remains to be seen," end quote. So this sounds like a bit of a disconnect between, again, what was promised and what will be delivered. Can the minister tell us the plan for the pilot? Is Doctors Nova Scotia engaged, and what health zone will the pilot be rolling out in?
I recognize the honourable minister for Addictions and Mental Health.
Thank you, Mr. Chair, and thank the member for the question. So like as I mentioned earlier, there's a thorough needs-based quantitative assessment that's undergoing right now. I think a significant part of the specific billing code question involves a significant dialogue with practitioners. So we've been very actively engaged in those conversations, and we'll continue to do so in the coming months, especially engaging Dr. Oral's office. They also have those clinicians also have to have significant feedback from the membership in their various professions. I mean, the vast majority, I guess, of healthcare professionals in general are self-regulated professions, right? So they have standards within their college. They have, certain educational requirements. Some of these individuals are in the public system, some of them are in the private. But those conversations are ongoing for sure. Thank you.
I recognize the honourable member for Fairview Clayton Park.
Thank you, Mr. Chair. Mr. Chair, there was some important work started under the last budget that would contribute to these universal addictions and mental health coverage. So single session therapy was a new service in the mental health and addiction sector. This service would meet Nova Scotians at their point of need, or those that are dealing with non-acute mental health issues like lower grade anxiety, depression, things like that. Last year, there was $5 million budgeted towards that work. I'm curious if the minister could tell me what is the plan for this year, and how is single session therapy included in this planning for universal mental health and addictions care?
I recognize the honourable minister for Addictions and Mental Health.
Thank you, Mr. Chair, and thank you to the member for the question. Yeah, so the single session is moving forward. So there's the final vendor has been selected. So there's just some contract negotiations that are ongoing right now. So yeah, that should take a number of weeks, and then implementation is looking tentatively like the fall, based on progress in that. I think I did have a couple questions myself, just in regards to, I think it's highly beneficial to have the single session therapy, but just to make sure there's proper processes in place if people need an additional session or sessions, right? So, so it's something that did kind of jump out at me, but I think that'll be a good thing, and it's as part of the proposal that would be a provincially wide, provincially utilized service. So it would be an expectation that they would be serving, the province as a whole. Thank you.
I recognize the honourable member for Fairview Clayton Park.
Thank you, Mr. Chair. Mr. Chair, in the election platform, this government was committed to introducing legislation that guarantees every Nova Scotian access to allied mental health professionals. I'm curious if the minister could tell me what the status of that legislation is and who is being consulted.
I recognize the Minister for Addictions, Mental Health.
Thank you, Mr. Chair, and thank the member for the question. So I would say the status is active and ongoing. In regards to consultation, I mean, significant number of healthcare professionals, people with lived experience. There's a cross-jurisdictional scan from a quantitative and qualitative perspective. I could probably have a more fulsome answer, but I'd probably be here for a while if we were to list every single person. Thank you.
I recognize the honourable member for Fairview Clayton Park.
I'm happy to have the minister provide that in written document and table it in the House to save time if he's willing to do that. We'll just leave that with him. Let's talk about addictions. I am going to run out of time. So addictions withdrawal management hubs, I know that the minister referenced them in his opening remarks. This is going to provide a number of complementary services, including an in-person assessment of withdrawal management needs, outpatient withdrawal management, psychoeducation, recovery skills, brief intervention, harm reduction. Like, these hubs are great. We're happy to see that the work continues under this government with $1.7 million, which was added to the budget for these services. I know that there was a commitment to have these addiction hubs through all of our zones. But in this budget, the Western Zone, and I am asking this on behalf of the member from Yarmouth, the Western Zone was not included. So one was promised at the Yarmouth Regional, where there is a huge need. So my question is, when can Western Zone expect the withdrawal management hub to open there?
I recognize the Honourable Minister for Addictions and Mental Health.
Thank you, Mr. Chair, and thank the member for the question. So I think they will be in all zones. Just to list a few spots here. So there's Lunenburg, Middleton, the Glasgow, Straight Richmond, Sydney, and Yarmouth, just to name a few. I think that being said, I have heard concerns, not just from your colleague from Yarmouth, but from my own colleagues in the Western Zone as well. There's been some gaps identified in Western Zone in regards to addiction services. So I'll be definitely going there probably shortly after this session concludes to speak to some clinicians and some folks in that area. I think it's important to know. I worked in addiction services. It was actually called Inpatient Withdrawal Management Unit, which the name in itself actually kind of deterred people from coming to seek the service out in the first place, right? Which is kind of, it's interesting when you think about it, I think. So I think even just having the names, recovery support centers, and just kind of adding additional programming for the staff and increasing accessibility, and very much not just focused on inpatient withdrawal management, allowing people to kind of get appropriate treatment and return home. But I think there's definitely some more work that needs to be done in Western for sure.
I recognize the honourable member for Fairview Clayton Park with less than 5 minutes.
Thank you, Mr. Chair. Okay, let's see what we can do in 5 minutes when we talk about telehealth and virtual care. So I guess I have a lot of questions on virtual care that are listed out, but I'm going to get to the crux. I'm going to try and get to the crux of it. So when we talk about virtual care for physical health, there is a lot of things that can be done remotely. You can do prescription refills. You can have a general consult with a physician. There is enough data that shows that people will continue to come back to a doctor, to a GP, if they're providing virtual care. My concern is that virtual mental health care is looked at under the same lens as virtual physical care, and it's a very different scenario, and it's a process that doesn't always have buy-in. It's an uncomfortable process. So I'm concerned, and I'm curious how we are measuring the determinants of success within virtual care. So virtual mental health care. So people who are accessing it right now, do we have data on how many people are continuing to log on to the app, who are, not double dipping by using the virtual care and then going into the ER? Like what kind of quantitative data do we have so far from the use of virtual mental health care, that it's actually helping individuals, but then also alleviating the stressors that are on the system?
I recognize the honourable minister for addictions and mental health.
Thank you, Mr. Chair, and thank the member for the question. So yeah, there is some provisions in the budget to curate an action plan to guide future investment. So really collecting robust data to develop an understanding of not only the effectiveness of the care from a clinical standpoint, but also from a patient perspective. So I think there's also some jurisdictional scans right now that are happening across not just the country, but I think globally. So that'll be really actionable within the next little bit. I think that we also have very specific data and numbers to identify the usage of our e-mental health tools. So MindWellU and the Therapy Assistance Online, known as TAO. So I think it gives us, what's interesting too is even over as the quarters last year progressed, we saw a significant increase in utilization of these services. So I think, just talking about mental health in general, I think people have different preferences or comfort levels of how they want treatment, right? Whether it's some want virtual, some don't, right? Some clinicians won't do it, some will. I think with mental health specifically for psychiatric assessments, I think the virtual component, it can't be done over the phone. I think probably minimally. It's just my experience. You need to see the individual. But if you have the right technology in place, I think the virtual care for this could have a lot of value. But we'll see as we kind of move along with the data collection. Thank you.
I will call it to order and pass the time over to the member for Cumberland North, and it is 9:24, and you have till 9:38.
Okay, perfect. Thank you. Thank you, Mr. Chair. Minister must be getting tired. Not too much longer. Okay, couple of questions for the minister. Around psychiatrists, I'm wondering if the minister would be able to share some numbers of how many, and you may have already shared this, my apologies if you did, but how many psychiatrists do we currently have in each of the zones, and how many more is the department actively trying to recruit? And if you don't have, oh, sorry, if the minister doesn't have the information, we could table it.
I recognize the Honorable Minister for Addictions and Mental Health.
Thank you, Mr. Chair, and thank the member for the question. Yeah, I think so I do have current vacancies here by zone. So these are kind of a point in time because some of them are contingent upon expected hires, which kind of can fluctuate based on people's circumstances. But typically since I've been in this role, the highest areas of need have been in Eastern and Northern. I think Northern right now is a vacancy of approximately 7.6. So like my goal would be to have every zone at full complement, right? Which is difficult, but even a significant reduction in the number of FTEs that were there would be something I'm definitely working towards. Thank you.
I recognize the member for Cumberland North.
Thank you, Mr. Chair, and thank you to the minister for that information. That would be incredible to have 7.6 more psychiatrists in the Northern Zone. I'm wondering if the minister can make comment on what the department's opinion is on psychiatrists being on call. And I feel very strongly that there's still huge stigma around mental illness, and I still see huge deficiencies in the way that we're funding mental illness versus physical illness. So personally, I think that psychiatrists should be on call 24/7, the same as internal medicine, the same as radiology, surgery, anesthesia, obstetrics, and included in that is a mental health crisis team, and I'm wondering what the minister's opinion is on that.
I I recognize the Honorable Minister for Addictions and Mental Health.
Thank you, Mr. Chair, and thank you to the member for the question. Yeah, I think there's on-call psychiatry would be 24/7. I know I worked through a transition period, just in my experience, where the way they would stop coming to physically be in the hospital after I believe 6 or 7 p.m., but they would always be available via telephone, or they would actually come in if it was an appropriate situation. I think what becomes an issue, something that I've heard about from folks, especially in Eastern and Northern zone that work as psychiatrists, is the call schedule can be quite demanding if you don't have the adequate FTEs. So you can be on call quite frequently. So it's a vital resource that's needed in emergency situations, but also you have to be wary, because if you're trying to recruit individuals in an under-resourced region, the call schedule will have to be adequate and fair, I think. I think the other part of this is we could look at innovative approaches, which we're kind of in the preliminary stages of looking at sort of virtual care options to take the strain off community mental health clinics in other regions. So I think that'd be my thoughts on that. But I think anyone that needs access to a psychiatrist, should have one, regardless if it's 24/7 or not. Thank you.
I recognize the member for Cumberland North.
Thank you, Mr. Chair, and thank you, Minister. I'm glad you made those comments, and would love to see, and I believe we can get there too. We lost a lot of psychiatrists in the province when there was licensing changes, right, and with the college, and we haven't been able to replace those. I'm wondering, with virtual care, is that also through Maple, and how will that be psychiatrists or just counselors? And if it's psychiatrists, how will they prescribe the controlled drugs, where we have the prescription monitoring service, and it's a written triplicate? So I'm just wondering how psychiatrists through virtual care will be able to prescribe.
I recognize the Honorable Minister for Addictions and Mental Health.
Thank you, Mr. Chair. Thank the member for the question. So there's two parts to that answer. So from a community mental health standpoint, it would be offered via social workers, psychologists, by a variety of disciplines. The specific question in regards to prescribing medication via the psychiatrist and virtual care in the ER, that's a good question. I'd have to find the answer out, to be honest with you. I know, there's, in rare circumstances, as the member would know, you can take verbal orders and telephone orders if you're, adhering to your college's regulatory obligations. So I think that my guess is that would be what they're doing, but I can have someone find the specific answer and follow up with the member.
I recognize the member for Cumberland North.
Thank you, Mr. Chair, and thank you, Minister. I don't think you can do the controlled drugs through call-in, or at least it's not been our experience, but okay, so my next question is around mental health crisis team. So in Cumberland, we do not have 24/7 crisis team. We have Monday through Friday, 8 hours a day. And my concern is that we're not giving mental health the same priority that we're giving physical health. So And when I did ask this question, one of the answers I was given is that there's not enough demand. But I would beg to differ. And when you look at all the other people that are on call 24/7 for an X-ray, CAT scan, laboratory, respiratory therapy, they might get called once through the night, once a week. But the fact is, our system is paying for them to be on call and available in times of a crisis or trauma, and I believe that our mental health crisis team should be available 24/7 as well. And it would alleviate a lot of the stress on the emergency department if they knew that there always was a crisis team to call up and help. And so it's more of a comment than a question. I wanted to when I hear someone from the Department of Mental Health say that there's not enough demand, that's telling me that there's still a stigma even within our own healthcare system at the leadership levels, because if we are funding physical health to be on call 24/7, we should be for mental health as well, and I feel very strongly about that. And so in relation to that, would the minister be willing to have someone take a look at that? Certainly the people on the ground in Cumberland are telling me if there was one thing that would make a significant difference in patient care and in the lives of the people working in mental health and addictions, the number one thing they told me would be to have a 24/7 mental health crisis team. Would the minister consider finding the funding to make that happen?
I recognize the Honourable Minister for Addictions and Mental Health.
Thank you, Mr. Chair. Thank the member for the question. Yeah, it's something I've thought a lot about, over the last number of years, to be honest. So I think right now we are reviewing all models of crisis care across the province. I think what becomes particularly challenging in rural parts of the province, in western and northern and eastern zones, the clinical composition of these teams and the mechanism where they're able to get to people would have to be very well thought out. I had the opportunity to work with a community outreach team in Cape Breton, which had a registered nurse with additional training and a police officer with additional training. They weren't 24/7, which was also a gap, for sure. I could not commit to funding tonight, but it's something that I'm definitely taking a hard look at for sure.
I recognize the member for Cumberland North with less than 2 minutes.
Thank you, Mr. Chair. Yes, thank you to the minister and for considering and taking a closer look at that. And so right now, because we don't have acute care beds at our hospital, at the regional, and because we don't, hopefully, I heard it's going to change, but because our facility is not under the Involuntary Psychiatric Treatment Act, that even if we had enough psychiatrists to be on call, they technically, legally can't do a psych assessment at our hospital, so they have to be transferred to Truro. So we are really reliant on the mental health crisis team. So when a acutely ill, mentally ill patient comes into the emerge, if it's Monday through Friday, 8:30 to 4:30, they do call the mental health crisis team and they come up and help the emerge staff and do the assessment. But so I want to just emphasize that is the number one thing that our mental health community team, as well as what I'm hearing from the staff in the ER, would make probably the single biggest impact on improving care in Cumberland. So I'll leave my comments with that. Thank you to the minister.
Thank you, member. I now recognize the member for Halifax, Citadel, Sable Island. It's 9:38.
Thank you very much. So I wanted to, I think, circle back on a few different issues, but one of the ones is around emergency care. And I think, as the member from Cole Harbour Dartmouth said, and as well as the member for Cumberland North talked about, I think I really have to actually just disagree with the statement that everyone who needs a bed gets a bed and that no one gets turned away. Because that's certainly not my experience. That's not the experience of many, many families who contact me and my partner to talk about their experience as families trying to access child and youth mental health care. So one of the areas where there is a huge gap actually is where young people sort of past the age of 5, before the age of 19, who have autism and are severely dysregulated, are becoming violent at home, in the community, and at schools. And they've regularly been turned away from the IWK ER, even when transported by police or EHS. And I can dig up a bunch of media articles to table with you, Minister. I can find, interviews that were done with Dr. Alexa Bagnall about this gap. So I'm wondering, if we're investing a lot more money in early intervention, how are we going to continue to support young people to be well? And would the minister commit to looking at emergency services for young people with autism?
I recognize the Honourable Minister for Addictions and Mental Health.
Thank you, Mr. Chair. I thank the member for the question. Yeah, I think I think there probably is some significant gaps in the 5 to 19-year-old continuum. I would agree with that. So I think if I'm correct, I think we're kind of referring to the kind of high acuity, high tiered situations. So there is a full service evaluation for the Halifax program that's planned for this spring. I know the member also referred to Dr. Bagnall. I do have frequent conversations with her and senior leadership team there as well. But it's something I would be definitely willing to look at. Yeah, thank you.
I recognize the member for Halifax Citadel Sable Island.
Thank you. That's exciting to hear openness towards looking at that. You referenced a full service evaluation of the Halifax program, and I'm just wondering which program are you referring to?
I recognize the Honourable Minister for Addictions and Mental Health.
Thank you, Mr. Chair. Thank the member for the question. Yeah, so the review is for the brief intensive outreach service program. Thank you.
I recognize the member for Halifax Citadel Sable Island.
Okay. I think, thank you for that clarification. I guess my concern is that perhaps that wouldn't necessarily catch these particular gaps, but I'm glad to know that you're willing to look at it because, I think, you talked about high acuity, and I think when we're dealing with folks with autism who are struggling, that actually it is hard to talk about in terms of mental health. It can absolutely lead to mental health challenges, and there can be comorbidity and that sort of thing. But I think there are some very specific needs there, and I think if we're able to be supporting young people, you know, pre-primary, then continuing that support is really important. Continuing on the issue of emergency care, so I'm wondering, well, I know that the minister and I have had a chance to talk about this actually, in terms of, you know, the work being done across Canada and different jurisdictions and around the world, looking at new models of emergency mental health crisis response. So really trying to do a few things. So one is, again, getting actual trained mental health clinicians face-to-face immediately, taking police out of the equation, both for concerns about sort of criminalizing mental health and what, you know, but also that, you know, police also don't want to be, you know, I think it's pretty universal, they don't necessarily want to be on the front lines of the mental health crisis in Canada. So as you know, Minister, I've been, or as the minister would know through the chair, I've been involved with an international working group that's been collecting a lot of data and models from around the world, and certainly Toronto, Ottawa, Edmonton, Victoria. I mean, cities across Canada are looking at this. So is the minister looking at new models of mental health emergency response?
I recognize the Honourable Minister for Addictions and Mental Health.
Thank you, Mr. Chair. I thank the member for the question. Yeah, so I think there's definitely a fulsome review happening now of emergency crisis response teams across the province. I have had frequent conversations and I guess reach outs from police services across the province, families. I mean, we just discussed with the previous question the potential for enhancing mobile crisis teams. You know, there's a lot to look at for sure. I think we're just trying to. I know something I think about a lot is trying to identify with the groups the appropriate training and make sure that they're properly prepared to help people, especially in a crisis. But these models of care are definitely being looked at within the department.
I recognize the member for Halifax, Citadel, Sable Island.
And you mentioned a full review is being done. Can you elaborate on that in terms of timelines and sort of what prompted the review, and also, you know, what data is being gathered to look at this issue?
I recognize the Honourable Minister for Addictions and Mental Health.
Thank you, Mr. Chair, and thank the member for the question. Yes, there's a robust jurisdictional data scan that will be finished in the coming months. There's also, as part of my mandate, I have to look at modalities of care across the province for access, not just for emergency crisis response team, but also with people right along the continuum of the STEP care model. Thank you.
I recognize the member for Halifax, Citadel, Sable Island.
I wanted to ask, actually, I have so many questions that now I'm just trying to choose one. Actually, let's keep going on modalities of care. So I know that the budget allocated, I mean, I think I have $600,000 for the work being done around modalities of care for consulting and evaluation. And so maybe you could talk about what that review is looking at specifically.
I recognize the Honourable Minister for Addictions and Mental Health.
Thank you, Mr. Chair, and thank you to the member for the question. Yeah, so there's going to be a robust evaluation of all current modalities of care, and also a significant jurisdictional data quantitative review of also potential new modalities of care. So just, I'll just give an example, just to make it more, I guess, tangible. So just using recovery houses as an example. So it'll be a very significant evaluation, I think, of recovery houses in the province, and sort of just kind of look at developing standards of care and making sure that there's a utilization of evidence-based practices, evidence-based harm reduction, sort of kind of just really streamlining it so people are really getting the best care that they can. Thank you.
I recognize the member for Halifax, Citadel, Sable Island.
Thank you to the minister, and I think all of that work sounds really exciting. I would perhaps hazard a guess, and the minister is welcome to dissuade me of this guess, that really what we're looking at is the development of a strategic framework, and probably the answers are going to lead away from this commitment to universal access through changing the billing codes for virtual care. So that would just be my guess, and I think it's probably the right way to go. I don't know how, I think it would be helpful for stakeholders perhaps to have a full sort of list of what's happening this year, what outcomes are being used, what assessment tools, just to have a sense of the breadth and depth of work that's happening, because I think I think you've invited, or the minister has invited members to have faith, and that big things are coming. And for folks like myself who've been on the front lines of struggling for mental health care access, that's sometimes hard to have faith, but understanding better what's happening certainly helps that. In the budget, I think there's funding for 2 clinical assistants in the Eastern Zone. And I'm wondering who these clinical assistants are, what is their sort of professional role or designation, and is the minister looking at more use of clinical assistants?
I recognize the Honorable Minister for Addictions and Mental Health.
Thank you, Mr. Chair. Thank the member for the question. Yeah, so clinical assistants, oftentimes they have potential pathways to full licensure based on their previous credentials, and sometimes they don't. In my experience, having worked with a number of them, they can do a lot of very valuable work from a clinical perspective. My experience has been typically they wouldn't have the authority, for example, to make someone an involuntary patient, but they would have a lot of very valuable insight and capability for treating people with their medications, for people that are maybe not as high of acuity, and for taking strain off this psychiatrist and the folks that see the crisis in the higher acuity people.
I recognize the member for Halifax, Citadel, Sable Island.
Can the minister confirm how many clinical assistants are currently employed in the province, and if there's a plan to increase those FTEs?
I recognize the Honorable Minister for Addictions and Mental Health.
Thank you, Mr. Chair. Thank you to the member. Yeah, so there's currently 6, so there'll be 2 additional in Eastern after this is recruitment and training in the process is completed. I mean, it's as we get new information, I mean, we'll make decisions accordingly. It's something I will be keeping a close eye on. It will be, yeah, thank you.
I recognize the member for Halifax, Citadel, Sable Island.
And I apologize, I am jumping all over the place, but back to virtual care. So there is virtual care being offered in the province right now. And I'm wondering, perhaps even taking, say, the last quarter, if the minister could talk about sort of number of people who have accessed virtual care, how outcomes are being tracked. So is there a pre and post assessment tool used, and what tool is used? And what happens if people complete, like how many modules are there, and if people complete that but then need to come back, are they able to come back again for further treatment?
I recognize the Honorable Minister for Addictions and Mental Health.
Thank you, Mr. Chair, and thank the member for the question. So just to give a little bit of, I guess, some data. For last year, so for Eastern Zone, I have each zone here. I'll just use Eastern as an example. So there's 299 total number of attended visits via virtual care platforms. The total number of attended visits via virtual care for one-to-one sessions, which are outpatient based, was 3,526. And the total number of attended visits via telephone, which would also be outpatients, was 25,719. So some pretty significant uptake. And I think, as I stated earlier, there's a significant data collection analysis that will be focused within the next coming months to determine the effectiveness of this on clinical outcomes. Thank you.
I recognize the member for Halifax, Citadel, Sable Island with 3 minutes left.
So just to clarify, in the current program, were there pre and post assessment evidence-based mental health tools used?
I recognize the Honourable Minister for Addictions and Mental Health.
Thank you, Mr. Chair, and I thank the member for the question. So any kind of treatment that would be offered would be evidence-based, regardless of the clinician. I think, if I'm understanding this, I think the question is relating to the mechanism to determine the effectiveness of the virtual care for clinical outcomes. So that's something that's actively ongoing. So in the coming months, we should have some very specific data regarding that as well. Thank you.
Recognize the member for Halifax, Citadel, Sable Island.
And so I would gather from the minister's answer that, in fact, there haven't been pre and post assessment tools used, the likes of which I think we both, the minister and I probably know what we're thinking of, but the types of standardized assessments. And I think that's actually, I know both is a challenge and a necessity in care. So I know more from the child and youth state of things in Nova Scotia that actually we have very little data that explores the clinical outcomes of young people. And so a lot of times that's because people don't finish their number of sessions that they're supposed to have, or they don't come back, so you don't get the post-assessment done. I know that the IWK joined CORC, which is the Child Outcomes Research Consortium based out of the UK. And so we've only got 1 minute left, but I might just leave it for further discussion, how the minister plans to increase the system-wide use of evidence-based clinical assessment tools.
I recognize the Honourable Minister for Addictions and Mental Health.
Thank you, Mr. Chair, and thanks to the member for the question. So just to maybe clarify a little bit, any kind of treatment, regardless of age or where you're at in the lifespan, would be evidence-based.
Order.
Oh, sorry.
The time has elapsed for this evening. It is now 10:02 and the House is set to adjourn at 11 p.m. That concludes the subcommittee's consideration of estimates for today. The subcommittee will resume consideration when the House again resolves into a committee of the whole on supply. So I ask you to return to your seats in the legislative chamber. The committee of the whole House must rise and report before the House concludes its business for the day. The meeting is adjourned.